1, 2, 3, 4. So I'm looking to see who else is coming on. Jordana. Suzuho, do we have quorum yet? I think we might.
Yes, Marky, you're at quorum.
Very good.
Okay.
Yeah.
Now, the other thing is, we're going to give it another minute. My computer says it's 12:59. Okay. Nan Sundine's coming on. Okay. Krista. Okay. Billy Batson. Okay. Kurt, where are you today?
I forget the town now. It's Arizona on Route 66.
Pretty cool. Hey, Tori got a haircut for New Year's. Okay, we have quorum. It is now right at 1 o'clock. I'm going to go ahead and call the meeting to order. And I do appreciate everyone getting on onto this call. And I know we're going to have a lot of other participants in the call because the agenda this today is got a lot of discussion that we will need to do. With that, roll call, I think, Suzuho, you can do the roll call, can't you, in terms of just seeing who's here? We've established, we've got quorum.
Yeah.
Okay, in terms of looking at the agenda for today, do I have any corrections or additions to the agenda? I don't see any hands going up. So do I have a motion for approval of the agenda as stated?
I move.
Thank you, Tom. I really appreciate a second.
I'll second.
Thank you, Greg. All in support, raise your right hand. Okay, unanimous. The minutes of the last meeting were pretty lengthy. So I'll see if there's any motion for approval to the minutes of the previous meeting.
I move for the motion of approval of the minutes, and I commend the person who did them very meticulously.
Thank you very much, Tom. They were very well done. Do I have a second?
I'll second it.
Thank you, Jeannie. Any further discussion on the minutes? If not, let's motion for approval. Raise your right hand. Okay, unanimous. Now, what we thought we would do today to start us off is talk about some good stuff that's starting to happen, and that would be the rollout of the vaccine, even though we're a little disappointed in terms of the quantity that we received. Carolyn's going to do an update. I did listen to Governor Polis's message yesterday as well regarding vaccinations. So we're all kind of in the same boat. We're not getting as many as we had hoped, even at the state level. So it looks like some supply chain issues, but I'm going to turn it over to Carolyn. Carolyn, I'm sorry. Why do I always want to call you Carolyn?
No problem. It's a little more confusing now that we have another Carly on board as well. So I'll kick things off here with our intro to our vaccine update, and I'll hand it over to Carly Senst, who is our vaccination and testing analyst. Next slide, please. So in terms of where we are at in the process, we have done 820 total vaccines between Aspen Valley Hospital and Community Health Services. We have another 200 that we're receiving this week that will be administered in addition to those 820. So what that means is that we've finished phase 1A, which is our highest risk folks who are working in healthcare in the emergency room. Those folks will be getting their second doses administered this month, meaning they're through the full series and will be fully immunized, which is great. We're almost finished with phase 1B, around the public safety folks. So we should be able to finish those folks up in the next week or so, depending on how much vaccine we receive. We've had some, with the holidays and such and people in quarantine, there's been a couple of folks that we need to get in that group and finished up. And then going forward, we have obviously a much larger group in our 70+ population to get started with 100 doses of Moderna. We have over 1,600 folks pre-registered who are within that age bracket. So I will let Carly speak a little bit to the pre-registration process, the registration process, and what to expect going forward. Next slide.
That was just a little name drop there. Thank you,
Great.
Dr. Levin, for going through on your immunization. All right, next slide, please. All right, so this was a big change to sort of the guidelines set by CDPHE. I'm sure at this point this has been up on the Pickens County website for a while, so hopefully everyone's been able to see it. The very large change here is sort of our age groups that we're focusing on now. So if you can look under phase 1 during the winter stage, if you go down to 1B, there's that dotted line. Big change is that people 70 and older have been moved into that higher prioritization group. Another age change is under phase 2. If you look at the just the first bullet point under there, it says people age 60 to 69. That used to just be 65. So not currently this effort is going towards, but definitely that age 70 and older is who we're focusing on now. Just so that everyone is generally aware, based on guidelines from CDPHE, we are not allowed to start vaccinating under that dotted line until we finish the groups above the dotted line. So that is sort of where that big shift of that 70 plus population came in. What the pre-registration form is and sort of how we're utilizing it is basically to get people's foot in the door so that we can have their contact info to be able to reach out to them once we know that we have those vaccine allocations and are able to make those vaccination appointments with them. We are currently, I believe, if I check my time, I'm working with our IT guys and we are sending out our first invitations to schedule that appointment in the next 5 minutes, which is very exciting. And that is for the vaccination clinic this Saturday. So going forward, this is going to fall under Pickens County's public health's wheelhouse. We will be utilizing that pre-registration form in order to reach out to those individuals and those other prioritization groups in order to get those appointments scheduled. Just for everyone's awareness, there is also emails going out to everyone within this risk group of our 70 plus that haven't been selected. They will also receive an email just to stay in contact with them, to let them know that we are working through that group, that we have started vaccination to their peers, and to just be on the lookout for their emails once we know that we can schedule those appointments. So, Carlin, I don't know if you want to take it back.
Next slide. Okay, and so I think Carly has already touched on the pre-registration form. So not a guarantee of an appointment, but the initial point of contact for us to be able to get in contact with you when we have doses available. A little bit of a shift we wanted to talk about is we have set up our incident management team to move towards a model of large-scale vaccine clinics. We heard from a lot of our primary care physicians that this model of administering the vaccine in the office environment in terms of actually being able to cover a large number of people in a short period of time. There's a preference for us to have a community clinic model to be able to get large numbers of people scheduled and to get those vaccines administered in a quicker period of time. So we're moving towards that centralized community clinic model. And that will allow us to use the pre-registration form to notify people when there are appointments available at that community clinic. So more details to come of exactly where, when, how, but we're kind of shifting our model towards this large scale vaccine clinic. Is there another slide after this? Or that's it, okay. And we'll stop for questions.
Are there any questions?
I have one.
Yeah, go for it.
Yeah, just a couple. First off, the lead time. When you contact somebody, generally speaking, what kind of lead time are you going to give them? 24 hours, 48 hours, longer?
For this initial, so that will change sort of going forward. Right now, we are only getting notified a few days ahead of time of how much vaccine we will be receiving. So for right now, we are sending out those invitations to sign up for an appointment. Within that invitation, it says, please utilize the online registration form, the appointment form, in order within 24 hours to schedule that appointment. We are also working through the process in recognition that some of this population are not as tech savvy, in order to reach out to them over the phone. So that 24-hour line is important for us to kind of utilize to know who to identify to reach over the phone, if that makes sense. Going forward, as this shifts, we hope, obviously, as our allocation increases and becomes a little more consistent, we'll be able to do appointments weeks in advance. But right now it is one of those moving quickly, have to fill the slots and get the vaccine in arms. So.
Well, I understand also that of the 1,800 requested, now this, I get the secondhand, and 200 delivered. Part of the criteria for that is how fast, and this is where I may be in error, but how fast the inoculations are given into arm. That if you, in other words, if you have an inefficient process, then you're not going to get your allocation. And on the other hand, if you're hyper efficient and they're out the door within an hour, that produces a greater allotment. Is that true?
I can take this one. I think there's some misunderstanding here. We have a super efficient system. So we're turning around the vaccine that we receive very quickly within the 72 hours that CDPHE is mandating. So it's not really a matter of we're not turning around vaccine fast enough. We don't have a clear indication of why we haven't received the full 1,800, because that is what we would like to be able to administer within a 10-day period to that population. So we asked for that amount, knowing that we had that many people in the 70+ population, and with the expectation that we would be able to administer it within that period of time. So it isn't necessarily reflective that we haven't been administering vaccine quickly enough in terms of what we're receiving.
Are other counties
I'd like to
receiving?
comment on two things.
Are other counties receiving a disproportionate amount too? Or are some getting everything they want and others more like us? I mean, why are we literally getting 10% or a little bit more?
I just wanted to make a comment as well. This is Dr. Levin, that might help clarify on top of the clarifications. The state is only getting a limited amount every week, 36,000. Now, the priority, as it was shown, is that you have to get through 1A before you can start 1B. And so there are counties that haven't finished 1A, and they're going to get priority to be able to finish 1A. We're done with 1A, and we're ready to do 1B, and we're going to start doing that. So that's a really important point in terms of allocation and which counties are getting what. And we believe that that was really behind some of the reason why we didn't get, a large percentage of our ask, is that we were already there.
And Kim, I think there's an update from the hospital. I might call on Dave Ressler to give us that update, and then we'll open it back up to questions.
Sure. Good afternoon, everyone. I'm sorry I'm a little bit late. I was actually in a meeting learning about the allocation from the state that we were just informed of this morning as part of the routine process. So as you have all been discussing, the hospital received 100 this week, and that will be administered on Saturday expeditiously, and making sure that we don't let any grass grow under our feet. The allocation for next week will be 1,000. So that is a significant increase. And in fact, it will be 1,000 Pfizers that many of you have seen or heard. Actually, you can get an extra dose out of many of the vials. So that will actually amount to probably more like 1,100. So at that point, we will be at 1,100, which we will obviously work to administer next week, plus the 100 for this week, for a total of about 1,200 out of the 1,500 that we had applied for last week to serve the 70, the population age 70 and over. So fantastic news that we just received.
I'd like to make a comment and ask a question. First, I went to the US Census because Aspen has a large number of retired people. And we have a population of 17,767, of which 20.3% are 65 or older, and 16.9% are 70 or older. So that 16.9% times the population means we have 3,000 people in Pickens County age 70 or greater. So just be aware of those numbers are larger than we might have expected. Secondly, Colorado has a registration system for immunizations called the CIIS, and we want to be sure that all of these immunizations are registered in a system so that people can retrieve that information in the future for a kind of a vaccine passport if they need that to travel. So are we registering all of these into the CIIS system?
Yes, that is a requirement of the COVID vaccine.
Thank you. That answers that question. Great.
And Dave, that was all great news. It's wonderful. Thank you very much for that update. I
Sure.
was a little discouraged when we got such a little bitty supply, so good news.
We honestly were, obviously as well. And I would just like to conclude by saying that we'll, of course, with this news, we're working with the IMT to identify, but they already had pre-planning in place. So we're not starting at the beginning to work out the logistics for the administration of these vaccines, and continue to be hand in hand with Carly and Jordana and the team at Pickens County to make sure that again, we get them administered expeditiously and safely.
So just for the community clarification here, Carly or Carlin, people will be notified by email, correct? Or by phone number?
So the pre-registration form did not require individuals to put in an email. We do recognize that that's not something that everyone has access to. So our primary method of reaching individuals will be email. So tell it, if people are listening or watching, do check your spam folder, do keep an eye on that going forward. If we do not get a response back from an email, or if our system flags an individual as not having supplied an email, we will go directly to a phone number.
You're muted, Marky.
Marky, you're still muted.
What else is new? One of these days I'm going to figure this out, and by then COVID will be over, hopefully. Let's move on. And again, I want to thank everyone for that great presentation and great news about vaccination. So glad Dave and his team and our team, the Public Health Department and John Peacock worked so hard to get another 1,000 doses coming in. That's phenomenal news. Let's move on to data presentation.
Great, thanks, Marky.
Okay.
All right, so wanted to start off with our 14-day incidence rate. We are continuing to get pummeled with cases. We have continued to receive 20, 30, 40, 50 a day at times. We did receive 114 last Saturday, not this Saturday, but Saturday before that. So we have just been very busy, and the contact tracing team has been very busy trying to keep up with all the cases that have been coming in. What I did on this graph is I delineated between all Pickens County cases, so individuals that claim Pickens County as a residence, and then we also sorted out those who are second homeowners. So the dark blue line there, that would be anyone that claims Pickens County as a residence or their county of residence, and the light blue line would be Pickens County excluding second homeowners. And so those are really people that spend less than 50% of the year here in Pickens County. So that's that blue line there. I also included Garfield County and Eagle County on here as well to show you what their trends look like. Both of them right around the middle of December, began to see a decrease in cases, and that has been fairly sustained for the last few weeks. You'll notice that Eagle has seen a slight increase recently, and Garfield is plateauing a little bit. But you'll notice that the trends between Pickens County, Garfield, and Eagle are there's very different. Garfield and Eagle mimic each other. Ours continue to go up, even if you exclude our second homeowners from our count. I also included in there where we were at the previous board meetings, so you can just see how quickly things have changed and how quickly our numbers have climbed from where they once were. Next slide. I'll actually go back real quick, Lindsay. I wanted to say one more thing. Back before the dial was implemented, we were using a 28-day definition to define cases. So we were saying anyone that stayed here 28 days or longer, we were counting them as a case because we wanted to follow up with them to make sure we were tracking all of those individuals. Once the dial rolled out and the definition changed, we changed our definition. We still track those individuals that are staying here for a month or more, and we still follow up with them, but we do not count them in our case counts. So I just wanted to make that caveat real quick. Next slide. And then this just shows you by month how many cases we've had in permanent residents and then how many cases are second homeowners. Again, we're defining second homeowners as anyone that claims to spend less than 50% of the year in Pickens County, and that's using the Council of State and Territorial Epidemiologist guidance, which is the same guidance used by CDPHE and CDC. This shows here that you can see in December, we ended up with 530 cases among permanent Pickens County residents and then 65 among homeowners that spend less than 50% of the year here. And then in the first few days in January, we've already seen 122 cases among permanent residents, with 31 of those being second homeowners. So already we are, if these trends were to continue, we would well be on track to exceed what we saw in December. Next slide. And then this is comparing us to other counties in the state. I included the incidence rates as of last night for a few different counties to give you a picture of where things are at. We currently have the second highest incidence rate in the state. Even if you exclude, again, second homeowners, we would still have the second highest incidence rate in the state. That is only behind Benton County. Benton County does have a pretty large outbreak at a correctional center occurring. The dial does indicate that those individuals are not counted in the calculation. So not sure if those cases are being counted or not. Regardless, we fall behind Bent as the second highest incidence rate. You'll notice the counties surrounding us all have incidence rates that are about half of ours on average. So Eagle's at 688, Garfield's at 811. The only one that is also over 1,000 is Delta County, but we are among 3 counties in the state that have incidence rates over 1,000. You'll notice on the Front Range, El Paso, Denver, and Boulder, they all have incidence rates in the 300, 400, 500s, and they have continually seen a decrease in their incidence. And one thing I wanted to point out on the dial is that the state is reporting cases that they received the day prior. So for example, when you looked last night at the dial, they were reporting all cases that they had received for January 5th, the day prior. We end up receiving a lot of cases that come in that had a lab result date of the 5th, but they come in several days after. Those cases are not included in the dial's calculation. So you may end up seeing incidence rates in the dial that are actually lower than what they ought to be because the dial would not have been able to capture that information just based on how they're sharing that information. I just wanted to make that point that the incidence rates are constantly changing, but since we can only ever see that one-day view, it's hard to really get an idea of how they're changing. And so we are using our local data and looking at our local incidents will give a better picture of how we're trending rather than looking at the dial alone. Next slide. So now I want to talk about a few things that we've seen that have occurred due to the increase in our incidence rates. So the first thing I wanted to discuss was disruptions to learning. So this shows you by month how many classes we've had to quarantine and then how many students or individuals we've had to quarantine from those cohorts or classes. So in September and October, we had 4 quarantine classes, which led to 47 to 92 individuals needing to be quarantined. In November, we had 9, and then December, you'll notice we had 18 classes that we had to quarantine, which resulted in 415 students needing to be quarantined at some point throughout December. So far in January, in the first few days, we've already had 3 classes that we've had to quarantine. We're actually working on all of those right now. We received all 3 yesterday and today. So we're working on those. But again, it's only been a few days since school has been back in session for Aspen School District, and then some of our other schools and childcares. We've already seen 3 cases among there, and we're pending several more right now to see if there's any impact to schools. But we know that when incidence rates are high, there is more disruption to learning. And so majority of these students on here, especially in January and late December, they had exposures that were outside of the school setting, but then of course went to school, and now we need to quarantine their cohorts in classrooms. So really the idea here is that if the goal is to keep kids safe and in school as much as possible, then it really takes the entire community and takes a village of our entire community to make sure that we are helping support our schools to keep kids safe and keep kids in school. So right now, if our trends were to hold, it'd probably lead to between 14 to 29 quarantined or classes needing to be quarantined, which could result in anywhere from 168 to 667 students need to be quarantined. And that's if our trends hold where they are right now. Next slide. So then the next piece that ties into that is the positivity rate among children. And I want to, before I talk about the data, I do want to state that Aspen School District data that they had done this week is not included in these counts. That's because asymptomatic serial testing, it can, it'll bring the positivity rate down a bit, and it might mask some of the other factors that we're looking at and trying to understand here. So ASD data is included in our positivity rate, and the dial does have that information. But for the sake of this graphic, I did pull it out because I wanted to show just without using that serial asymptomatic testing, what we're seeing with positivity rate. If you include ASD data, it's actually still pretty high. So it's the positivity rate would still be higher than it ever has been, even with that included information. But if you look here, the red line is our 14-day positivity rate. You'll see right around the first of the year, we had a 7.6% positivity rate. And then moving into today, or sorry, 2 days ago, we were at 17%. The 7-day incidence rate is at 33%. So really what we're seeing is there is an impact to children when it comes to positivity rate. We're trying to assess what that means. We don't exactly know what the cause was there. There is definitely an association with travel. So we know that individuals that had traveled, we have seen some of those students who were then exposed may have a higher rate of positivity. So that's part of the reason there, but we don't have a great answer for what we're seeing. The point here is that looking back at, or thinking back to the last slide, when we look at disruptions to learning, and now looking at how many students we're seeing now impacted by COVID, it's concerning. And it's of course concerning for our schools who are trying to keep kids safe and keep kids in school. When we think about community measures, mitigation, and supporting our schools, looking at how this is now impacting children, that's a very important consideration for our entire community to take in hand at this point. Next slide. And then on top of that, we have been learning a little bit more about these new variants in the UK, that was first discovered in the UK and South Africa. There was a report out of the UK showing that the variant was found to be more infectious among children. The South Africa variant, they are still looking on or looking at whether or not the impact is greater there. So we have started sequencing to understand, is there something else occurring here in Pickens County, which is leading to increased incidence or leading to increased positivity among children. We have sent in about 40 specimens now. AVH has been sending in the bulk of those. Valley View has also begun to send in specimens. As of the 5th of January, no specimens that we had sent in for sequencing contained the UK or South Africa variants. All the variants were, all the viruses that were found did not have any substantial variant to them. So they were fairly normal for what we see circulating across the US at this point. The map down here shows where the UK variant has been discovered. So we've had 2 cases in Colorado, and then you'll see that there's been more in Colorado, Florida, and then 1 apiece in Georgia and in New York. It has been discovered here. We're still doing some more research to determine whether or not that's impacting us here in Pickens County. Next slide. This is our source of exposure over the past 2 weeks. So this is where individuals have noted being exposed over the past 14 days. Household spread continues to be the #1 source of exposure among individuals in Pickens County, followed by workplace or unknown community spread. So 23% apiece for both of those. So again, unknown is people do not know where they were infected, but tested positive for the virus anyway. Then you'll see less likely our friends. Informal gatherings have been less likely to be noted as a source of exposure in the past 2 weeks, even though we know that they're occurring. And then travel has been less than that. So really the point here is, we're still continuing to see that the main source of transmission is household spread. We try to get every single person in the household tested just to understand how spread is occurring in households. That's not very dissimilar from other counties, but we do work to try to make sure that is occurring to understand transmission there. But work and employment transmission has gone up recently. It was at 18% in the 2 weeks prior, is now at 23%. So we've seen an increase in transmission in the workplace in the past 2 weeks. Next slide. So now looking at outbreaks in the past 2 weeks, we've had 35, I'm sorry, this is not the past 2 weeks, that's a typo on my end. These are outbreaks that have been ongoing. So these could be up to a month old, not the past 2 weeks. So we've had 35 outbreaks that we are currently working on that have started anywhere in the past month, any point in time. So we continue to see the most number of outbreaks are occurring in the restaurant sector. So 43% of our outbreaks have occurred in restaurants in the past month. Following that, we have seen the retail contribute to 11.4% of our outbreaks, and then the rest of them are a little bit smaller. Healthcare and recreation have been contributed to 8.6% of our outbreaks, or 17% combined, and then just a few other outbreaks here and there. On the right-hand side, we show case counts by outbreak type. So how many cases are occurring per the outbreak setting. So in our restaurants, we have had 86 individuals that have tested positive and have been associated with an outbreak in a restaurant, which is 52% of all of our outbreak cases, case counts. And that is 11.8% of all cases that have occurred in the past month. This only includes cases where we have determined that transmission has occurred in that setting. So there may be more cases associated with the restaurant, hotel, for example, but these are only cases that we have found to have likely had transmission in that setting. So again, restaurants are making up 52% of all of our current outbreak cases. Hotels are making up 15%, retail 7%, and then the rest to a smaller degree. Next slide. And then lastly, my last slide, just want to show all of our current outbreaks. So again, the 35 outbreaks, what the setting is and how many cases we are seeing per outbreak. So our largest outbreak was in a hotel setting, and we confirmed 21 cases that had transmission occurring within the hotel setting. So that is our largest, followed by 4 restaurant outbreaks that have 10 or more cases associated with them at this point. And then many more that are smaller. We have received 6 new outbreaks that have been reported to us in the past 2 days. And so we're still working on those. There are likely more than 2 cases with some of those at this point, but we're still working on trying to identify all the possible cases there. Some of them are, some cases are Garfield and Eagle. And so we have to work with those health departments to identify if they have any cases also associated with those. But these are, majority are of the new ones are Pickens County residents only, but there may be others associated with it that we don't yet have included in these counts. And then again, just as a reminder, the outbreak associated cases must have presumed transmission at the setting in question. So if someone's living with someone else and they both work at the hotel or the restaurant, for example, we do not count that as a case within that outbreak. These are only where transmission actually occurred in that setting. So that's pretty much, that's the update that I wanted to share. I think Dr. Levin had a quick comment that she wanted to share on just hospital data that I think she just has some better information than I do on that. So we'll hand it over to Dr. Levin real quick to share that information.
Thanks so much, Josh. That's really, really great. I just wanted to, again, reiterate the importance of looking at data, of trusting the data, and not only looking at state data, but looking at our local data that Josh did such a great job outlining today. I just wanted to mention the matrix at AVH remains the same. So it is in the red, continues to be in the red for healthcare workers out, which at this today I think is 15. Inpatient and outpatient remain stable at green. There is a very important development that happened in the past week at AVH that I think everybody should be aware of, that we've had 2 transfers out for COVID patients. That makes a total of 8 over the entire pandemic. So 2 were in the past week. And I think concerning of these 2 different cases that they were both what I consider to be fairly young. One was a visitor, 45-year-old male, and then the other one was a local resident in the mid-50s. So, compared to what we see as hospitalization data and death data really affecting mostly the 70 and 80-year-olds, I think it was concerning and important to note that these were 2 in their 40s and 50s and both fairly healthy, and one being a Pickens County resident. So, and I think they're both doing well or improving at this point in a lower altitude location. And in addition to that, I think it is, I just wanted again to reiterate the data and the importance of, there's some conversation about false positives in the community and trust in the type of testing that we're doing locally. And our testing has increased greatly, and all of that is really great news. There's so much testing going on now, even compared to a month ago. And really these tests that are being performed are all performing very similarly in terms of their positivity rate. These tests have what's called a high specificity. So a positive is more likely to be a positive. It is really the negatives that we have some concern about, the rate of false negatives. So it's a false negative rate that we, all of these tests have some degree of, and we always ask you to put it in context in terms of what your symptoms are and your exposures. So if you have a negative test, that's always the risk of people feeling a sense of false confidence in a negative test. And if you have symptoms, that you still need to treat it as if it were COVID and a potential false negative. But the positives are fairly securely positives. So again, a lot of confidence in the data here that Josh presented. And then also my concern as well about the increasing incidence. There's comparisons looking at the state. And of course, we know that at a state level, there's been a 14-day average decline as a conglomerate state data. But the importance of looking at local data, and I think it looks like being the second highest county in the state and the highest county, a very dissimilar county that's in the southeast region of the state that has a large prison population, and us being second. So I think we are potentially in a pocket here. And the good news is that there's no evidence of the variant at this point, but there's concern that it may be here, which has known to have a higher transmissibility rate. And that I think we need to take this very seriously, that we are potentially in a pocket. And why are we a pocket? There's so many variables. We're in a tourist industry. There's a lot of people coming in town, but the truth behind the data is that there's only 14% that are visitors of the recent incident rate, the recent 14-day incident rate. So a lot's happening in our population. Concern about the impact on schools, as Josh had noted, and really looking at our county as being a potential outlier within the state at this point. So that was, I think those were my main, and the last point is really to look at the outbreak data and to have a lot of confidence in our outbreak data, that the concerns about what Josh presented today and the different industries and where this is being transmitted locally. I think that's it, unless there's questions. Thank you.
Mark, you have
Josh, we did see a lot of notes coming into the chat box from Jeannie and I think Krista. Krista or Jeannie, could you talk a little bit about what has been posted? Because I don't know if everybody is able to see that in the chat room. And then I'll call on Patty.
Thank you.
Sure. I'm happy to talk, and Jeannie can talk too, but basically we're just posting the information that came out this morning from the school. And I just want to second Josh on how, as a mother and part of the school testing, incredibly disruptive this is to families. We just actually got an email from the school, and Jeannie put in there kind of the breakdown of the high school and the kids that were from high school, the kids that were from middle school. And Jeannie, maybe you have this, but there actually was sent from the school just now a breakdown of exactly how many people are going to be affected by this. And it's over 100 of students, staff, and teachers from the school. So that's just from our testing that we did on Monday and got results back last night and today.
Yeah, I can tell you the breakdown. So there were 8 students in the elementary school tested positive, resulting in a quarantine of 10 staff and 4 classrooms, and 101 additional students quarantined, plus 2 buses. Then 2 students at the middle school were positive, resulting in the quarantine of 1 staff and 1 classroom and 10 additional students. And 2 students at the high school were positive. Sorry, for the elementary school it was 8, but 2 students at the high school, they're remote, so it doesn't affect the quarantine.
Thank you very much, Krista and Jeannie. Very, very concerning, to say the least. And I just looked at our report that Andrew sent out about 1 o'clock, and I saw the incidence rate is now over 2,200 for Pickens County, and that's the adult population. Patty?
Yeah, I just need some clarification on this last slide with the setting and number of cases. So with, for example, in restaurants, are we talking restaurant employees only, or are we talking customers of restaurants that feel that they may have been exposed in a certain restaurant?
Thank you, Patty. Thanks for letting me clarify that. These are employees only. We don't include patrons since we're not able to identify whether or not that was where their exposure occurred.
Okay, and then another question. So those in the restaurant employees, excuse me, I don't have COVID, I have eating peanuts. Do we have any correlation between those employees? Are they from the same household? Do they carpool together? Are they roommates? Family members? Because, a lot of people in the restaurant industry come up here together or work together and live together. So do we have any correlation there that there could be that in-household exposure?
Right, and that's what I tried to explain. So these are only individuals that don't have any sort of outside exposure. So the only place where they could have been exposed to each other would have been in the restaurant.
Okay.
So they don't carpool together, they don't live together. The transmission would have occurred at the restaurant.
Okay, so that's just for clarification, and thank you. And do we know which restaurants these employees are employed by?
Yeah, are you asking which restaurants these outbreaks are occurring in?
Yeah.
Yes, yeah, and these are all 15 different restaurants.
Okay, because I spent a lot of time in town, and there are a great many restaurants who are really, really following the rules, and there are your outliers who are not. So it'd be interesting to see if it's those restaurants that we've had complaints and had to follow up with the consumer protection to see where these numbers might be coming from those restaurants that we know we have issues with as far as compliance.
Yeah, you're correct, Patty. So there definitely is, we do have restaurants that are very compliant. We have other ones that have not been as compliant. We have not really looked at that piece. When we do our investigation, we do ask about all those pieces to try to understand, what does your what do your mitigation strategies look like? Is everyone wearing a mask? Are you distancing? All that kind of stuff. We do ask all those questions, and it's a mixed bag. We have some that are very compliant and don't understand how transmission has occurred. We have others who, have not been as compliant. And so there's a lot of room for improvement, but I'd say it's been a mixed bag overall.
Okay, because I think that would be interesting because, you know, I'm so well aware of the issues of compliancy with certain businesses, restaurants in town, and the hard work that other restaurants are doing to be in compliance and keep their doors open. So I just think that's an interesting, you know, comparison to look at the restaurants that we know we've had issues with and their rates of exposure and cases versus the restaurants that are doing a great job. So I just, that's something I would be interested in seeing.
Sure, yeah, we can work on that for you, Patty.
Thank
And
you.
I think another important piece is to consider is, you know, we don't know what kind of exposure is occurring between patrons and the restaurant employees. It's so hard for us to know. But we do know that, you know, when you're in an enclosed environment and are unmasked, there is more of a opportunity to spread or transmit the virus. So, you know, restaurant workers may be more at risk based on those types of exposures. So it's just hard to really understand, you know, exactly who, you know, where did the transmission start? Who was that initial case? Was it an employee? Was it a patron? It's really difficult to tease.
Right. Well, and I'll tell you, because I've mentioned this before, I don't cook much. I go out and eat a lot. So I'm probably your best person to talk to about restaurant compliancy and who's doing what. But I've noticed that, and I think this is a great idea for people who are in restaurants, a customer who's in the restaurant when they're not actively eating or drinking, that they keep their mask up, especially when the waiter or waitress, the server comes up to their table. I've seen more people doing that, but probably not enough people doing that. And I think that would be a really positive thing to start adding to our list of compliance issues.
Patty, what if we roll into our next presentation? Brian from Consumer Protection has some slides for us, and then I think the thing that we're seeing now is that even, you know, with an incidence rate as high as it is, even businesses or people who are following as many of the precautions and rules to a T are still being exposed to COVID. It's just a matter of it's rampant in the community.
Well, and I think that's good to know. And the last thing, and then I'll let Brian come on, but I think one of the things we really need to be looking at is grocery stores. They've fallen way back in doing any mitigation measures. I am more nervous going to the grocery store than I am going to a restaurant, just because it's very haphazard as far as, you know, wiping down carts and people going up and down the aisles in the same direction and people touching the produce without availability of gloves. I mean, there's a lot of things I think we could work on in the grocery store realm, but I can bring that up later. Thanks, Jordana.
Okay, let's move on. I think, Brian, you're up to talk about consumer protection, and we look forward to your presentation.
Sure. So yeah, I have a pretty short presentation, but I can talk about what happened over the last couple of weeks through the holidays with our observations. If we want to switch to the next slide. So we are continuing to work on getting more staff online. We're pursuing to get 3 additional staff members. We did just hire 1, and we'll be conducting interviews to try to get 2 more in the next week or so. And for these last couple of weeks, we did focus on trying to be out in town more, especially during the later hours to 7 or 8 p.m. to look for these concerns that we keep hearing about regarding table spacing, restaurant capacity. And we saw pretty much every type of issue in these restaurants at one time or another through our observations this past week. Obviously not one restaurant's doing every single one of these issues, but we've seen a lot of these things as far as being more than the 25% capacity, spacing tables closer than 6 feet, having their people at the tables not being spaced at least 6 feet apart from other household parties. We've banned indoor events at the last Board of Health meeting, and we're still continuing to see those being held. The mask issues, just like Patty said, with putting your mask on when you're not actively eating or drinking, that's an expectation of the current public health order. So anytime you're in a restaurant, you should be wearing your mask if you're not eating at that moment. So keep that in mind. Over the past 2 weeks, we saw 31 complaints come in regarding different businesses not following the guidance properly. Most of those complaints are for restaurants. During New Year's, we did send out a lot of warnings, making sure that everyone understood the requirements they were being held to as far as the 9:30 last call for alcohol, 10 p.m. business closure, as well as the general guidance that they're required to follow, including a lot of these complaints that are listed above. And we issued 9 warnings to restaurants. We issued 4 notices of violation for operating past the 10 p.m. closure. We issued 1 notice of violation for repeatedly seating households closer than 6 feet apart. And we issued a notice of closure for a bar serving alcohol past 9:30 as well on that weekend. And the more people we have out, we're going to try to be looking for these violations and making sure that everybody understands what they're required to be doing. If you want to switch to the next slide. Just like this was something that John Peacock said early in this pandemic, but I just want to reinforce this, that we can't enforce our way out of this. We're not going to stand in a business and stand there 24 hours a day waiting for something bad to happen. We have to rely on these businesses to be doing the best that they can and operating the way that they're supposed to be. The problem with this right now is that when our incidence rate is this high, there's still likely going to be spread in a restaurant or other businesses with long amounts of time that you're spending maskless in an indoor environment. And I just wanted to mention again, if businesses can't abide by the guidance that is required of them per their sector, the public health order requires them to be closed. So I just wanted to reiterate that too. And we're going to switch the slide again. So this is the big portion of this, is that we've seen many studies that show that indoor maskless environments carry the most risk of exposure. And the more time that you spend in those environments, the more likely that you will be exposed to this virus. And staff have to be in this environment for long periods of time while they're working, exposed to many, many people that could be carrying COVID. And we've seen currently 1 in 38 Pickens County residents have COVID-19 that's transmissible. Many people, it's transmissible 2 days usually before you're symptomatic. And a lot of people may not develop symptoms at all. So it's extremely likely that if you're in a business with 50 people inside it, that 1 or more of those people is currently transmitting COVID in that environment. And then we mentioned this earlier, but there's 15 current outbreaks in Pickens County restaurants right now. And then I just have a graphic. This was a study, a case study from Korea. So each one of these tables was spaced about 6 feet apart. There was 1 person who was in the restaurant who was positive with COVID. The source who was sitting at that center table. They had no contact with these other tables whatsoever. They were only in the same room for 15 minutes. And due to the way that the air flowed through these buildings, it exposed additional 5 people from other tables that they had never even met. So I just want to be really clear that when our incidence rate is this high, the likelihood of something like this occurring is extremely high. And I don't think I have anything much else to talk about if there's any questions.
Questions for Brian?
Not so much a question, Marky, but since I was quoted, I also just want to say that it's not just businesses. We need the cooperation of our community members and guests to be doing the right things and helping the businesses out, helping our community out with compliance and preventing the spread. Businesses have a heavy load to carry with helping us prevent the spread, but it can only be done as a community effort to squash this virus. So just wanted to add that.
Thanks,
you
Tom.
very much.
Or John, that's a great point, that it's all our responsibilities.
It's everyone, and it's really sad to see what's going on. I mean, two weeks ago when we were together, or 3 weeks ago, we had hoped that we would see a decline in our incidence rates, and it's gone straight up, and we've got issues now at the school, quite a few problems over at the school. So being an old nurse, I said, it's about time to do some surgery. But Brent, I see you have your hand up.
Well, just quickly, does the, this is just a question for everybody, but does the public have a right to know which restaurants are, more conforming than others? Period.
Good question, and I'm not a lawyer, so.
Yeah. Well, I will say that I think that is part of the intent of a 5-star program. If we do that in the future, it's not just about the change in practice, but it's also the ongoing kind of enforcement, and whether a restaurant or retail business or gym or personal service provider is able to maintain that 5-star designation through repeated inspections. We have not, we've really, as we do with other code enforcement issues, we are really first working for voluntary compliance, and then we pursue notice of violations and closures has been our process.
Well, I understand that, and I just want to phrase this correctly, because I certainly don't want to hurt any restaurant. However, as a member of the public, if one restaurant is just doing a terrific job and another restaurant is doing a terrible job, I would argue that I have a right, maybe I don't, but I would argue that I have a right to know that, because I would adjust my behavior accordingly. And of course, it would be a terrific incentive to restaurants to know that this data is going to be published, so they better, be on their toes. But again, that's just a question.
And I think as we pursue a 5-star program, Brent, and in the future when we qualify for it, that will achieve that goal.
Okay.
Patty?
Yeah, real quick, Brent, and Brian, you can chime in here if you would help me with this. But when we do regular restaurant inspections, it's my understanding when you have violations, that's public information. And I don't know if sometimes there's notices posted on the doors or somewhere where the public can see if a restaurant has been in a general public health when they do restaurant inspections. So I don't know if that's the same under a pandemic kind of situation, but that's my understanding with restaurant inspections. Is that correct, Brian?
I mean, we have not really ever posted restaurant inspections to any Pickens County or City of Aspen restaurants. They are available for core requests. I don't know what type of outreach we would want to provide if we do want to go that route.
Yeah, I think we need to clarify that with the county attorney, but we can do that another time. But I have a question specific to your data as far as consumer protection. Do we have a breakdown on restaurants between Snowmass and City of Aspen? Because I'm starting to hear from people concerned in Snowmass about social distancing, et cetera.
Yeah, I mean, we definitely are doing inspections in Snowmass Village as well as Aspen and the outlying areas of Pickens County. We have coverage across all of the Pickens County area. We get complaints from Snowmass Village and we investigate them. We have seen some issues and have worked with the businesses to try to correct those.
Okay, thank you.
Any other questions for Brian?
Marky, this is Kurt. I wanted to follow up really quick with Patty's question about posting. So Patty, there's some pretty specific language around the retail food code that we would need to verify with our attorneys on how that would be affected with the pandemic, about being able to post any type of scoring information on a restaurant at the door. But I know we can do that online and at a website. which is the most common way people do that. So that's something we will have to look into because it's statutorily required.
Yeah, that's
Or-
what I
or
thought. I think,
it's-
that's what I thought, Kurt. Thank you for getting back on that.
Marky, Greg here.
Yeah, Greg.
Wasn't sure if you could see me. On that topic, I just received a text from, anecdotally, somebody says, you know, the public and restaurants don't know about the mask while sitting protocol that we're have as an order. And a friend was at 3 separate restaurants in town. One of the restaurants knew and asked about masking up between bites. And the other 2 very famous, popular local restaurants didn't say anything about it and didn't apparently know. So that's just an informal poll someone took around town. I was going to say that I think that we might have a PR and marketing effort before us so that we make sure everybody is informed about this, you know, just what the rules are, and whether or not we post the specific rating for a restaurant and how many outbreaks they've had on their front door, which I would not be against. We could certainly at least post the rules to make sure that the rules are posted on the front door, and maybe also post where we stand regarding outbreaks and the incidence of outbreaks in the various businesses on the front door. So when people are entering a restaurant, they know what they're getting into. They have an idea about the risk they could be taking.
Yeah, and I don't think we would want to punish a restaurant for getting an outbreak reported to them. It very likely is not anything that they could have done differently to change their behaviors. Just like what we're seeing with this graphic on the screen right now, these transmissions are very difficult to follow, and we can't just 100% say, "Oh, you had 2 outbreaks, you must be doing a terrible job." It's not really working that way.
I want to clarify that. I wasn't trying to figure out how to punish people, but I think that certainly anybody walking into any business or any situation in our community we should do our best to inform them about the risks that they could be taking, and the data that we're looking at now could be helpful in that regard.
Okay, just wanted to make one remark on just based on all of this. I'd be curious to know, you know, at some point in a community when the incidence rate is so high that even doing your very best in a restaurant following all protocols, there may be some outbreaks. And I don't know if we have information on that, but that would be my concern at this point, that it really isn't, some of them may not be following protocols and there may be outbreaks there, but then others who are and still having some outbreaks would be the concern.
Correct. Okay, any other comments?
Marky, real quick.
Greg, oh, sorry.
Go ahead, Greg.
Just to say that apparently the info about masking up between sips and bites in a restaurant is in the Pitkin County order, but it's not in the summary of the order. And it's possible a lot of people just don't read the full order, but they might look at the summary. So it's possible we just need to publicize that better. Is that correct?
Probably yes. The other thing that I've noticed in some restaurants here in Snowmass, we have table tents with what's required in terms of masking, which is very helpful because you always look for something to read on the table. Now you got to clean it off and all that good stuff, but it is another way to communicate with the expectations.
I just wanted to mention that my team did do outreach about these masking requirements to all the restaurants in City of Aspen, as well as Snowmass Village. So every business should be aware of this.
Thank you, Brian. That's very helpful. Patty?
Yeah, I just received some information from a restaurateur about the posting that they have at their restaurant, which says, you know, please wear your mask when interacting with wait staff, etc. And that's posted as a welcome to our restaurant. And it also gives more information about the protocols, the rules and regulations. And, you know, a lot of restaurants, Greg, so, you know, already have that at their front doors. Then some of them, it's nice to hear, Mark, you do have tabletop tents, because I think Greg recommended that at one of our previous meetings. But there are a lot of restaurants, especially those who are following the rules, that have the rules posted kind of in your face when you enter their restaurants. Thank you.
Let's move on if possible. I'm very cognizant of time. And I know that our next presentation will be by Nan Sundin, talking about human services. And then we're going to move into support for businesses and individuals, which I'm really excited to hear about as well. So go ahead, Nan, good to see you.
Hi, Marky, thank you. And Sam Landercasper, the Economic Assistance Manager, is with me. We'll go through this quickly because we know you have a lot to do, but we were asked to kind of present the impact of everything that's happening on the individuals and families that we're serving. So next slide. Just a reminder that Human Services functions in the Emergency Support Function 6. So we're really focused on shelter and housing, food and supplies, mental health, people with access and functional needs, which is basically people with special needs in a disaster. And in COVID, it's a big population now. Communication, the impact to youth and families, and then at the same time, just trying to ensure the continuity of our own mandated services. Next slide. Oh, nope. Okay. We changed it up, so we're using, you must have uploaded it. So I'll let Sam go.
Thanks, Nan. My name's Sam Landercasper. I manage the Economic Assistance Department, and the data that you're looking at here is from 2 surveys that we did. Early in March, when the pandemic set out, we were able to stand up an emergency assistance program to help Pitkin County residents with housing and utility issues. We received nearly 4,000 applications in 4 months, 2,200 of which were for unique households. Of those 2,200, approximately 2,000 provided email addresses, and that's how we administered this survey. We administered 1 survey at the end of July, following the close of that program. Also, I'd like to, about $2.3 million was issued through this program over 4 months. And then we did a follow-up survey just recently in November, and that's where this data comes from. And what we're looking at here is a comparison between those 2 surveys and our respondents' responses. So the first chart you'll see on the left is employment hopefulness. In both surveys, respondents were asked if they felt that the income from their employment was going to be sufficient to meet their needs. A response of 1 meant that they did not believe that it would in any way, and a response of 5 meant that they would have no issues. And what we really see here in this is that between July, which is the dark blue line, and November, the light blue line, a significant shift downward in people's hopefulness around how their employment would be able to meet their needs. And we found after we looked at the numbers that this was about a 10% drop between July and November. Similarly, in the next graph, we have we asked people about their financial stability, and the exact wording of that was, how would you rate your household's current financial stability? Response of 1 meant that we will not have enough income or resources to meet our essential needs this month. And a response of 5 was, I will have no financial concerns at this time. So once again, you can see that there's a substantial shift towards the negative in this form. And I believe that that one was estimated at about 16%. So we're seeing that folks are much more concerned now than at the end of July about their financial ability to meet their needs. If we go to the next slide, please. All right, so this last line graph that we're seeing was asking people about their housing stability. A response of 1 meant that they felt that they were going to be losing their home shortly or were already homeless. A response of 5 meant that they had no concerns around their housing stability. And as you can see, we see that shift again to the left, where the majority of responses were either a 3 or lower. This one was about a 10% change from the original responses as well, going from July to November. In the bar graph to the right, we have the food pantry. We asked folks if they had been attending food pantries both in July and November. The main thing we wanted to call out here is the change between the folks who reported no need and as well as the change in folks who reported that they do attend food pantries occasionally, because you'll see there that the people who reported no need decreased significantly from July to November. And we see that inverse on the occasional use has gone up. So just seeing an increased demand for food resources there. We can go to the next slide. All right, and finally on these charts, this first one on the left is the, we asked people if they were still in need of assistance at the time we surveyed them, meaning, do you feel that you can meet your needs financially, yes or no? And if you look here, we see that the main thing that we see is that the folks on the far right who said no help needed, that decreased by over 20% from July until November, meaning that a large number of people have gone from feeling like they didn't need additional assistance to now needing it. And finally, we asked folks if they had applied for the SNAP program. That is the Supplemental Nutrition Assistance Program that provides food assistance for folks who are low income. Our caseload in that program doubled at the onset of the pandemic and still remains about 50% higher than usual. I see that the data somehow got inverted, but our interesting fact that we're pulling out here is the people who reported no need went from 54% in July down to 44% in November. So just highlighting that need for food resources that correlates with financial need, housing instability, and concern around employment. Are there any questions around that data?
Okay, next slide then. So one of the things we're watching always is federal and state resources to provide financial relief. In fact, while we've been on this call, I got notification that the Treasury is releasing rent relief funds, but it will only go to communities that have 200,000 people or more. So, learning the nuances of this, how rural areas are ever going to access these dollars, I don't know. We have more to learn. I just looked at it quickly. But one of the programs that's come to Colorado from the federal CARES Act relief funds is the Property Owner Preservation Program. So this is a way that landlords can apply on behalf of tenants to get to support rent relief. And this is data that came out in late November from the Department of Local Affairs. And you can see that the property owners program, if you can read it, I'm having trouble, but the far left says Front Range. So 96% of the households served were on the Front Range, and 85% of the households, I think with rent, were on the Front Range. If you go to the middle dots that you can hardly read, the West Slope really had, an average of less than 2.5% utilization of these funds. There are a lot of speculations about that. Alpine Legal Services is suggesting that possibly landlords and some housing authorities are saying, if you give the money to landlords, if the power is in the landlords, they may not pursue rent relief in favor of having tenants build up debt that once the eviction moratorium has lifted, they can then evict them. And we know in our community that our real estate is hot. So you could get rid of a worker and get a second homeowner in and have them pay the full fee. These are the risks that we have. One of our partners, Community Aspen Family Connections, that provides some rent relief, said that they are having trouble getting landlords to complete W-9 forms because we like to give the money directly to landlords. Landlords, who knows? There are a number of reasons why they may not want to fill out a W-9, including accountability for taxes and income, right? But it leaves the tenant really powerless. And we're really concerned about the change, what is happening here, the lack of access. I've been advocating at the state level that more funds get released to tenants and not landlords. But now to see that the federal dollars are going to communities with 200,000 or more, I mean, it's very frustrating. The last slide is just sort of a general overview, and what I think you probably all know, but we will reiterate here. In November, we had the second highest unemployment rate in the state at 10.2. We won't know December's until mid-January. What we know in this community is that we have employees who work more than one job. And so they're not counted here if they've lost one or part of their jobs. So what we believe exists in Pickens County is a significant underemployment. People who used to work 5 days a week, maybe now working 2 days a week. People used to the gig economy and tips, living really primarily through the whole off season on their tips, not getting tips at all now, or having a significant reduction in their access to tips. Financial assistance partners that we have. So Sam said that we did all the economic assistance in the first 3 months. After that, we created pathways with our partners. So families go to the school resource center and Catholic Charities takes individuals without dependent children. Both the school resource centers and Catholic Charities are showing a 3 times increase in awards for financial relief. And now the numbers sometimes, in our small county seem unremarkable. The family resource, Catholic Charities since August has served 86, and they've since January 1st, they've had 73 requests for funding. Family Resource Center is in the same boat, where in the second half of the year, they provided assistance to 53 families, and their phone has not stopped ringing since January 1st. So the demand for rent relief and financial relief of all kinds remains high. And I know Josh is slides on the impact to learning, the disruption in learning is significant. Consider the impact to families when those children have to go home and parents have to stay home with their children or find some way to take care of them at home. 901, I think, so far, and that doesn't count the new outbreak. So we hear all the time about families struggling with inconsistent childcare, working, not working, the stress in the home. We work with public health around quarantine and social isolation. So when we looked on the day we developed this 2 days ago, I think there were 300 people in quarantine or isolation. We get referrals from public health for people who can't do that successfully on their own, can't stay home. So in the first quarter, we got 46 referrals for what we call access and functional needs support. In the last quarter, we got 120 referrals, and 60% of those were asking for financial assistance because they do not have employer-based benefits, no salary, no sick time, no COVID time when they're not working because of this gig economy. 40% were asking for food delivery and food assistance, pretty significant. The last part that we have here is just, the food distribution remains high, which is evidence of the financial insecurity that Sam talked about. In senior services, we continue to see about almost 1,200 meals delivered a month to seniors at home. The mobile pantries are reporting the same, serving about 2,000 households a month. And we have been successful supporting the opening of Lift Up in Aspen, providing food, and they are serving 30 households a week, about 66 individuals a week. So the economic and social impacts of COVID are huge. We understand the implications of all the decisions that you have to make, but we wanted an opportunity to share the individual and family experience. That's all we have today. Any questions?
Wow. Any questions for Nan? Pretty darn significant work there, Nan. Pretty sad too.
Yeah, thank you, Marky.
Okay, let's move on. John and Michaela.
Thanks, Marky. And yep, just waiting for the presentation to come up. Wanted to just brief the board a little bit about resource changes and upcoming business support, both locally and at the federal level. So Michaela and I are going to tag team this a little bit. Wanted to note for the Board of Health that the Board of Commissioners has been aggressive in applying resources to continue to build capacity to respond to COVID. And so we did, as you heard earlier in the presentation, mid-December, additional appropriations were made for consumer protection staff. Sorry, my cat actually stepped on my keyboard and deleted the presentation earlier today. Thank goodness for undo buttons. But we've also increased appropriations for case investigation and contact tracing, putting up a hotline support, particularly around the affidavit. And then there's a few pieces in here that are relevant to what Nan was just talking about, and the challenges of our business community. So we've identified a need really in the community for navigation. And what that is someone who can help an individual or small business understand what kind of state, federal, or nonprofit support might be available to help bridge these difficult times. What we're finding, as you just saw in the last presentation, is that we are not always taking advantage locally of all the resources there are for individual and small business support. Nan has been convening conversations really to see if we can bring this concept to a little bit more of a regional discussion. And so we're going to be, I think, continuing that next week, Nan, and hopes of really more of an Aspen to Parachute type of program for the whole valley. We also have appropriated funds really for Nan's department to be able to partner with nonprofits if they're experiencing a gap in funding and responding to individual or household needs. We did hear pretty clearly from our nonprofit community that they didn't want to necessarily have big grants with specific strings or objectives tied to them, but some flexibility that as they're trying to meet the needs of individuals or households or workforce, that they've got the ability to maybe draw on smaller sums. And so we've set aside a pool of an additional $400,000 for that purpose. Back in December, we'd also talked about a $500,000 grant program to be launched concurrently when we qualify for a 5-star program to help with HVAC improvements or compliance with that program. More recently, this last week, the board authorized staff to start putting together a more generalized small business grant program, particularly in light of both events like the gas outage that happened in Aspen that affected folks at the busiest time of the year, and the just bookings and such that we're seeing in January and February being significantly down. So details of that will be coming out, but we are having a conversation about partnering with Aspen Community Foundation to look at running that grant program with us using CARES Act dollars. And then we allocated additional funds for more outreach campaigns this year. Then in addition to that, I'm going to ask Michaela to talk a little bit about what we understand federal support opportunities might be, particularly the next round of paycheck protection. So Michaela, I will pivot to you.
Sure. And if we could just advance, I think 1 or 2 slides, one more. Very good. So a second round of Paycheck Protection Program was approved in the second round of CARES Act funding that was signed December 27th, 2020. The reason this is a really great option for businesses is because it provides forgiveness, which allows businesses to completely be reimbursed. What's new with this second round of PPP is there is an expanded scope for what businesses are allowed to ask forgiveness for and use the loan for. There is now a maximum loan amount of $2 million. Previously, it was $10 million. And lodging and food service operations with fewer than 300 employees per physical location are now eligible for up to 3.5 times the average monthly payroll costs. Who is eligible? Businesses with 300 or fewer employees, including sole proprietors, independent contractors, etc. Previously, it was businesses of 500 or fewer. This bill allows borrowers that returned all or part of the previous Paycheck Protection Program loan to reapply for the maximum amount available to them. So even if there's still an open loan from the first round, they're still eligible to apply for the second round. What is a little ambiguous is how those two loans will interact with one another. We're still waiting on some guidance from the SBA there. This resource from the U.S. Chamber at the bottom here provides a really good overview of business eligibility and what this program looks like. If we could advance to the next slide, thank you. So there's a lot of discrepancy regarding when the program is effective, but if businesses received PPP of less than $150,000 in the first round, then the SBA has 15 days since December 27th when this was signed to come out with official guidance on a simplified forgiveness process. So this is one of the new aspects of this program, this simplified application process. It's a one-page document that's really easy, but the SBA has yet to provide the documentation or this form rather. So once the SBA does release that new form, banks have to then adopt the new form into their systems and portals, and then businesses can apply for this loan. So there's a little bit of a lag time there. If businesses received PPP above $150,000, and if the bank or lender is already accepting PPP forgiveness, then forgiveness applications, then businesses can apply now for PPP2. There is ambiguity on how these funds will be dispersed or distributed, and when a business applies for PPP, then the period for which expenses count toward loan forgiveness will begin on the date of the loan origination and the end date of your choosing. So that's between the 8 to 24 week time frame. It's also unclear how PPP2 again will interact with the current PPP loan program. And So the Northwest Small Business Development Association is still working on guidance, as the Small Business Association is still working through their legislation and setting up processes here. So realistically, we're looking at businesses being able to apply for forgiveness around late January, early February. And we will be in contact with the Northwest Small Business Development Association regarding what this process looks like when it becomes more developed. So overall, this is a really great program for businesses to get some funding back. However, it's not black and white. It's very much case by case regarding what the forgiveness looks like and what it can be applied for. Are there any questions?
Any questions at all? Well, I'd like to applaud Pitkin County for taking the leadership there in terms of the various grant programs. That's absolutely wonderful news for our business community. And Michaela, thank you so very much for this information about the new law that went into effect on the 27th of December that we thought we'd never, ever see. But finally it happened, and hopefully now we'll see additional help coming to our business community and our various community members. So if I don't see any hands go up, I'm going to move on to our next segment, which is a staff recommendation. And this will be presented by Jordana.
Thanks, Marky. We can go to the next slide. So I wanted to give some background here on where we've been and then what the staff recommendation is going forward. So since September, we've been really honing in on using this framework for the dial and trying to be consistent with what our community can expect with how we move to different levels between the dial. You know, we were in yellow and orange all the way up until November. And we had really been honing into the community and sharing that while the CDPHE outlines that when counties move between the levels in the dial, that if their metrics bump up to the next level, they consult with the state to either move to a more restrictive level, or if their metrics are in a less restrictive level for 2 weeks, then they can consult with the state and move down to that level. In practice, the movement from orange to red was not just having one metric in red for 14 days, but it was that one metric in red and then an additional metric that goes into red for at least 1 day. And as we've seen, our incidence rate has been in the red since mid-November, while our positivity and hospitalizations have never bumped up into the red. So if we go to the next slide, we can see that, you know, what did happen in mid-November was many of those counties who are in the red level indicators moved to red, a lot on the Front Range, a couple around the state as well, and were in red for a number of weeks. Coming mid-December, these counties went in before Thanksgiving. They were able to help us see this reduction in our incidence rate across the state. And then they were really feeling the economic pressure of being in red for that amount of time. And that the state was really, and the governor were trying to find ways to be able to help businesses while they were in that red level. And so what first started happening was this 5-star program kind of came out with some ability for businesses who are in counties who are in the red, but if they were declining in incidence, could apply to some of those businesses who would be able to operate in those orange levels. And then so this 5-star program was happening. In Pitkin County, we are currently not eligible for the 5-star program because our metrics would have to be solidly in that orange level. If we go to the next slide, we'll see the other thing that was really happening was that a lot of these counties who had moved into red were able to see that decline in their incidence rate. And then the governor made the decision to Monday to move all counties that were in the red out into the orange level restrictions. I think they really based that on many of these counties had been in the red for about 5 weeks. They had been seeing these decreasing incidence rates. And when they were being pulled out, counties who were in the red going into orange had incidence rates 500, 700 range, and some even lower. And so, 8 counties currently, including Pitkin County, are enforcing stricter public health orders than required by the state. And that's really the background of where we've been. So we've had the dial, we've tried to stay consistent with what we've been saying. We haven't had that second indicator flip. We're seeing the impact of our super high incidence rate, even without any of these other indicators go to red. And what we know is that other counties who went into red did see that decline. And then the state ended up pulling them out a little bit earlier than they had said before because they were really adjusting to that economic pressure. So that's the background for everything that we're considering today. If we go to the next slide, we'll really see that, Pitkin County's orange plus plus that we've been trying has not brought our incidence rates down as evidenced by all of the data that has been shared today. Test positivity is increasing. It has not yet hit that red level. And hospitalizations have not. We've had 2 people go into the hospital as inpatients in the same day, but we've never had 3. And so we haven't hit that red level. We have consistently communicated that 2 metrics on the state dial would have us go to red to adopt the full red level restrictions. But our current incidence rates are really unlikely to decrease without any further protective measures. And they're impacting our ability to attend work or school without being exposed to COVID. So just as, what Dr. Siebold and Dr. Giesel shared with us earlier in the call, we're seeing the kids who went back to school, the resulting COVID positive cases and quarantines that have resulted in that. And then to Nan's point, how that disrupts families, how that disrupts having to stay home, not being able to work, and on down the line. So if we go to the next slide, the questions that I really want the board to be thinking about are, do we continue to hold this line of only moving to red level restrictions if we get that second measure to flip? Do we consider moving to the red level restrictions based on a high or increasing incidence rate and really rethinking our criteria locally for what should work for us as a county? And then thirdly, are there any additional protective measures that we need to consider? And so, Marky, I'll just look at the next slide for the staff recommendation and then turn it up for discussion. So the staff recommendation is to really think strong. The staff recommendation is to adopt new criteria for moving into and out of those red level restrictions. So what the proposal from the staff is to move into red level restrictions if the incidence rate is above 700 for that 14-day period. If one metric is in red for 14 days and another dial metric goes into red for any period of time, that could also move us there. But this other criteria would be just dependent on the incidence rate, which is what we've seen is where we're at in the community and what has become incredibly problematic for us. If we change these restrictions, we'd also want to look at what would it mean to move out of the red level restrictions. And so again, using that 700 as an incidence rate, that it would need to hit that, and that it's been decreasing for 14 days in the right direction to hit that 700 to move back into the orange level. So we base this on a few factors. One is these are some of the 700 level of incidence rate is double the 350 that the state had originally outlined as the threshold for going into the red level. But what we're seeing is many of those counties who were able to reverse their trends and come out of red when the governor made that change on Monday, we're in this range. And it's also where we feel like the box it in strategy in the community can continue to work. And so those were some of the reasoning behind this recommendation for what we would like the board to consider for what we think could make a positive impact for these more protective measures in the community. So Marky, I'd turn it over to you for discussion, and then just thinking about the things down the line. If we do adopt any of this new kind of criteria, we need to think about when that would go into effect, noting that if we are going to be going into those red level measures, that would close indoor dining, that would close any kind of indoor events. And we want to give proper time. We've heard at least 7 days of notice, but before that would be feasible for both businesses to prepare, as well as our human services team, who would be seeing the effects of a lot of people being impacted by this decision.
Marky, I would add one more consideration for the board, because this is, in a way, it's changing the goalposts that we've been talking about with the community, and that the state had really set for us. Gosh, I think we adopted this back in September, is that right? I'm trying to remember the month now. And so, another consideration for the board is this is a significant policy discussion. And so you may want to take this recommendation and schedule an upcoming meeting, whether it's a week out from now, to collect more feedback and reaction or ideas, because there may be other ideas that emerge from the community of a more significant, shorter term type of shutdown to try and bring the incidence rate under control. There may be some other ideas that we'd all want to consider that the community would be willing to support. So you may want to give a little bit of time for that community conversation, and to let some of this recommendation really percolate in the community. So I'll just throw that out there as another consideration for the board.
Thank you very much, John, for that comment and suggestion. Needless to say, we all know that what we've tried in the past is not working. Incidence rates continue to climb. When I looked at the information about our children and what's happening at the school, I'm very, very concerned. And as we heard from Nan, really appreciate that presentation about the economic and emotional impact on our families. This is going to be a very difficult policy discussion, and one that does need to be vetted very carefully. So with that, I'm going to ask the board if you have questions for clarification. And I do have people in the public who will be wanting to make some comments. So I'm first going to open up to the board members and the alternate board members for questions, clarifications, thoughts, comments, and then I'll turn it over to some public comments.
I'd like to comment that we need to take, I'm in general in favor of the staff recommendations. We need to take this in context with the dates that are coming up for the MLK weekend on January the 18th, Winter Skull, and the X Games, and see how these adapt to the staff recommendations.
Thank you very much, Tom. In terms of Winter Skull events, are those being canceled this year, or are those still on? etc. We know X Games will only have participants and people that are sponsoring and working for the X Games. And MLK weekend, who knows how many people are going to come into town. I haven't seen the occupancy numbers for that weekend yet. But thank you very much, Tom. Other people on the board? Patty?
Yeah, I'm since Tom made his comments so succinct, I think John Peacock's recommendation of we need to get more input. I think, you know, I'm really am concerned about the incident rate, but I'm also concerned if the impacts, the social, the financial, the mental health impacts, if we shut down restaurants again. I'd like to see us look again. We have a very creative community. And let's see if some better ideas come forward as to management of restaurant activities. And I would really like us to look at doing something about the grocery store, getting them back into doing the things that they were doing before that they're not doing anymore, because that, I think, to me, people go to the grocery store. They don't always go out to dinner, but they're going to the grocery store, especially if they're not going out to dinner. And I think we need to institute those same restrictions we had before at the grocery store. And I think we need to do that sooner than later. I think that's critical. And I don't think that's a problem in, you know, making sure that we're protecting public health at the grocery store. I think that's a valid point. I don't know how it changed and why it changed, but I would like to see us go back there. I really want to hear from the public that has been watching this meeting, but I think John Peacock's idea about, you know, bringing in some more input before we just slam the door on going into the red zone. I think that's critical.
I also think that restaurants are one segment, but I think whatever we do, we've got to get every segment of business in our community on the same page. So with that said, I'm going to see Greg, I see your hand up, and then I see Tori's and then Brett's.
Great, thank you. Yeah, I appreciate what John said, and Patty as well. It seems as if what we're hearing from the restaurant community is they're feeling it should be a community-wide order, and it shouldn't be just focused on restaurants. And I do appreciate, and I have heard that. But we also know, despite the best efforts of the restaurants, for the ones who are being conscientious about it, we still have a breakaway in terms of our incidence rates. And so without trying to punish anybody, we do need to be really cognizant of that. What I'd like to find out is that if we are actually looking at closing things down more, the best thing we could do would be to reach out to the business community, take some time now, as everyone has suggested, and find out what the best time would be. If we have to shut down for a week, if we have to conceivably close things down for a week or two to get on top of this, what would be the optimal times to do that? And I know it's not an easy question, and it's uncomfortable to talk about it, but we should at least be aware, if we're going to shut down, when would it be? That's what I wanted to ask.
Greg, can I just clarify that currently all the other sectors of the community are under red level restrictions? It's just the indoor dining that isn't yet under that, and it's not, you know, takeout and outdoor dining is still permitted under those red level restrictions. I just want to clarify that.
Great, thank you, Jordana.
And there's a note that just in Winter Skull is virtual this year. So Tori, you were next. Well, wait a minute. Tori was, and then Brett, and then Patty.
I just want to clarify what Jordana said.
Patty, what part do you need clarified?
Well, so what are the grocery stores supposed to be doing if they're technically a business that's supposed to be under the red restrictions? I mean, because they're definitely not doing what they were doing at the beginning of this.
Can you qualify as to what grocery store?
Any of them. They're not enforcing people going one way down the aisles. I've noticed that carts are being wiped down randomly. They're not monitoring the number of people coming and going in and out of the store. You used to have to wait in line to get into City Market. Now the person just stands there and the doors open and close and people come and go. And I don't see any of the past efforts that they were making happening currently.
So
okay.
I think we can work on that from a complaint perspective, and we'll bring that to our consumer protection team. But in terms of what is required under the red level restrictions, those are in place for retail at this point in time.
So does that mean limited number of customers in the store at one time?
It would, right?
Yes, it's got a capacity.
Yeah, because they're
limitation.
not counting. They're just letting people come and go anymore. So I will file a formal complaint on the form to get that ball.
Patty, I have seen them lined up and counting people as they go in. So maybe.
But it's random. It's not consistent.
All right, well, okay. All right. Thanks, Jordana, for that information on that. I'm sure we'll follow back up with that. I think there's some of each there, right? Patty's correct, and you're also correct. I think that there is some compliance, some enforcement. They're doing as much as they can, probably not as much as they should. I had a first question was about the threshold level of 700. Can you just speak to the threshold level of 700 as far as the incident rate?
So I can share that is, if we are only going to be looking at incidence rate, right? If we don't have that second indicator pushing us into the red at an earlier point in time, where the normal incidence rate is 350 to go into these red level restrictions, we as a team came up with the number of 700, thinking that where we start to see a breakdown in the effectiveness of the box it in strategy is when the incidence rate gets higher than 700. We also reasoned that, when the governor released a lot of these counties from red into orange, 700 was kind of that middle average that a lot of them had already reached and achieved. So we were trying to take what was currently going on and make some, choose a level and a policy that would be aligned with the standards across the state.
Tori, I can add to that as well. That with an incidence of 700, that gives us about 9 cases per day, and that's where we felt the contact tracing team would be able to be most effective in trying to box it in. So it was really based off that type of data, looking at the contact tracing perspective.
Thank you for that. Okay, let me just say that in representing my board, Aspen City Council, we are understanding of the recommendation that's coming forward. We have some questions about details like that, why 700 as a threshold, what our expectations can be around that. We've also got other questions about releasing ourselves from some of those. Now, you are setting that threshold line at 700 and utilizing that as the watermark there. So I guess I understand that your suggestion would be until it came below 700, that we would not be having another discussion at this board for releasing ourselves from any of those other restrictions or lightening them up. That's an issue for us. We do want to know more about that, about our local control, I should say, over releasing ourselves from additional restrictions. With that being said, I still think that there are opportunities and avenues for us to get a better grip on this than we have right now. I have a couple of questions. For example, in the numbers and the data that we saw today, where it alludes to restaurant outbreaks and cases that are associated with restaurant transmission, probable restaurant transmission, have those forced any closures? Have there been any closures of those restaurants in this latest round?
So no restaurants have, we have not recommended closure on any of them. We've been working with them. A few have decided to close, either because they didn't have staffing, because so many people were quarantined, or just because they wanted to be able to do a deep clean. So none have been forced to close, but several of them have closed.
So, I would bring that up as just kind of an avenue that we could probably make a better headway in containment if we were to adopt more of a program like that. If I recall correctly, over the summer, we had just a few outbreaks. I think it was maybe 3 different establishments. And I think all of them closed for a few days, somewhat on their own volition. I think that the county health team was supportive of that, but they closed on their own. So I'm wondering if that is not a first step that we should be taking, is where we are trying to isolate where these cases are happening. I think what we've heard here is a lot that they're not all created equal. Some are doing some better than others. And that's maybe where we should be basing this off of. So that's number one. I just want to talk about the potential for us to exercise more containment strategy by closing down some of these places that are having these outbreaks, and giving them the chance to make sure that their operations are safe and secure. Another question that I have for you is about the use of antigen tests. The rapid tests and the antigen tests that are available these days. And I know that there's questions, and I've asked some of these questions about getting some verification for their effectiveness. But the same thing is that these tests are available even as low as $10, $20. I'm wondering if it shouldn't be where restaurants are testing or have access to these antigen tests and are testing their employees almost on a daily basis, if you will. For that kind of cost, I think it's very accessible for a lot of restaurants. So I wonder about antigen testing for not just restaurants, but any indoor facility. Number two, I do want to remind and encourage the outdoor dining, which is still available in red level restrictions, I believe. So outdoor dining is definitely something that we need to be looking at. In the warm days that we can have, that makes sense, but during evenings, that doesn't make a whole bunch of sense. I wonder, again, as I said, council's biggest question was really about our local control, about putting ourselves into higher level restrictions and what is our ability to get out of them. You've put a metric to that, so that answers that question. The next and maybe the last thing is that I still hear is that while restaurants are seemingly are becoming more a part of the data and the numbers that we're seeing, there are still catering events, there are still private events, there are still groups meeting. One of those questions I have about groups are about group sales. I've seen a few congregations of persons that are definitely here as a group. Some of them are actually getting out and enjoying some of the base of the mountain area. And I'm just wondering about what we're doing about those as well. So again, this city council is supportive of the overall suggestion, recommendation. We do want to take some time and reach out to the business sectors that are going to be most impacted by this. We do see the call for action that the public health is making, and we respect that. But we do think that there are still some unanswered questions on a little bit more of the precautions that we could be taking in an immediate sense. Thanks.
Thank you very much, Tori, for all of those questions and thoughts and issues. And I'm sure staff has so noted your questions. Needless to say, we've got a lot of work to do to answer all of the questions that are coming forward. Anyone else on the board or alternate regarding, I'm looking. No, I don't see anyone with their hand up. And therefore, I'm going to turn it over to public comment.
I have just one comment, Marky.
Yes, go
Brent,
forward.
yeah, I just wanted to say that I'm getting cut out here, but pardon me, I just want to say that I agree with what appears to be the majority on everything that Tori said. Anything moving forward, you know, we're now moving into existential decisions for the business community, especially, but also for the public. And this idea of cheap antigen tests and all this kind of stuff, I think argue for maybe a single purpose meeting to deal with just exactly this and getting input from the community and the media.
Yeah, I will be bringing that right back around as we start getting public comment at today's meeting. And all of you might want to think about getting your calendar out, because I will more than likely be calling a meeting next week. So with that said, let's turn on the opportunity for people that are participants or attendees of the meeting to ask questions, provide public comment. And we really look forward to your comments. It's very important. And as you might have additional questions as well, similar to what Tori had, that would be very helpful as well.
Thanks, Marky. Yes, I did just open the raised hand feature as well as the chat box. So for those who are on the phone and want to speak, please press *9 to raise your hand and then *6 for unmute.
You see
And
me?
I will call, yes, I do have a few. We will start with Wendy Mitchell. I will allow you to speak.
Hi, I just wanted to give a few comments from the restaurant perspective. We're all on our phones, like I'm sure everyone else is, talking to each other on the text. And I think a big part of what we're all feeling in the restaurant community is that we're being singled out, whereas ski-co, hotels and groceries are not. If we do something in our community and do shut down, I think it's really important we think about doing it fairly and across the board. So it's effective for one thing, but also so people don't feel totally left out. I think if I could just take a minute to just give a situational analysis of what's going on with us. So we just had quite a few people out last week. We had a couple of employees test positive, and then we had probably, I think, 7 people quarantined. That's a big chunk of our staff. Makes it very hard to operate a business. We were able to figure it out, but what I found really interesting is, like, as a business owner, I want to protect my employees first and foremost. So we paid for everyone who wanted a test to go get a test, whether or not they had worked with people that had been exposed. And then, of course, anyone who had worked with someone that was exposed was quarantined and then tested. Of all the people that tested together, that, like, so say we have a line cook and he worked with our chef and 2 other people, and then they all carpooled home together. None of the people except the one guy who was positive tested positive. So I feel like, it's a situational, it's not scientific, but it does show that these measures of wearing masks, social distancing as much as possible, washing your hands, all these things, all these protocols that we've put in place are working to prevent the spread at work. I think being able to determine if someone is positive and is huge. So the antigen tests that would be such a boon for the restaurant industry. But I just wanted to give that little example, like what's going on in the restaurants is not because people are sitting around. I mean, maybe in some places it is, but it's not because people are sitting around without masks. I think everyone takes their job very seriously and everyone takes their business very seriously. We're a tight community. We all support each other and we've worked together for a long time. And, no one wants to get someone else sick and no one else wants to make someone quarantine that's not sick. So people are taking this seriously, but we're not seeing the infection coming from people working together. I think we're seeing it more coming from someone's kid got sick at school, someone's girlfriend got sick, their roommate, something like that. Those are more the places that we think that it's coming from. The only other thing I just wanted to say, like, I don't think we should shut down because I don't mean to sound insensitive, but there are not any deaths in our community related to this. It's scary. And my husband was really sick. I totally get the seriousness of this disease, but we're not seeing people dying from this disease. And I think when you get to the point where you're saying you can't work anymore, you can't feed your family, you can't pay your rent, that kind of stress and emotional distress on individuals is really upsetting. And I think that is a harder toll than people getting sick or quarantining. So I hope that doesn't sound insensitive, but that's just my personal opinion.
Thank you very, very much, Wendy. Very well said.
Thank you.
Okay, anyone else with a hand up? I'm watching the chat box, a lot coming in through the chat box.
A quick question there, Marky. Since Wendy was just speaking, can I ask, Wendy, you're not doing indoor seating at your restaurant right now, are you?
Oh, Wendy.
You're muted.
Did that work?
Yeah.
Yeah.
Okay, we're serving dinner from Meat and Cheese at Hooch. So we have 6 tables down there. So it's, you know, under 24 people, which is not very many. But we're doing all takeout upstairs at Meat and Cheese.
Thank you. I asked that because I just find it interesting. Wendy just shared her experience over the recent days of the amount that she's seen in her establishment. And she is currently not doing indoor seating in that establishment. I just thought that was interesting.
And the people that were positive were all working in the upstairs grocery / restaurant takeout, not at Hooch.
Interesting. Thank you.
Okay, other hands going up.
Marky, I can, oh, Bill, did you want to speak before I select another attendee?
Yeah, I just wanted to make a comment about moving into the red level when the state is in orange. I think it's, you know, incumbent upon us to make sure we're communicating, you know, what the expectation is within Picken County. And I think we're getting really good traction with our traveler affidavit. I've heard a number of stories about private pilots not even, you know, taking off because one of their people didn't do the traveler affidavit or didn't get their test back. And I think that, you know, the messaging needs to be continually pushed out there as to what the expectation is. And just as we're talking about, you know, putting your mask on in a restaurant, I think a lot of people just didn't understand that. And if we can push that message out there, I think that that would, you know, hopefully encourage people to, you know, go further and really take this seriously. But I think that shutting down the restaurants, you know, is emotionally, physically, and economically is going to be a real challenge for people. I think that's should be a real consideration, as well as going above and beyond what the state is recommendation.
Thank you, Bill. Any other hands going up?
Yes, I will select Francis Kapoor. And please limit your responses to 3 minutes. Thank you. Francis, can you hear us? Looks like you're on mute. Okay, I will move over to Jimmy Yeager.
All right. Hi there. Okay, so I'll try to keep this very brief, a little bit difficult. First of all, John, thank you very much for the suggestion of moving into a specialized meeting to really have a more detailed conversation about what can be done. You know, I think we're moving so far away from the idea of mitigation because we're so weirdly based on what does the state say red is, but now they took red off the table for all the counties, and now we're talking about going into red restrictions. If you want to close inside dining, my suggestion would be to go to purple and just close it down. Because if you just close down in dining for restaurants and indoor events, which are the 2 red restrictions that we're not operating by, and nothing happens to our incident rate, what are you going to do then? If it's not decreasing and restaurants are closed, and therefore you can draw a conclusion that restaurants were not contributing to the climb of it, then what? You know, and so I understand that there's great motivation to try to get a handle on this, and I don't disagree with that, but I am so uncertain that 85 employees out of 12 to 1,500 is somewhere in the realm of 0.5 to 0.7%. So that's almost a half of 1% of our worker population has shown up in the last 2 weeks to have tested positive. And we're not seeing any other sector analysis. And I'm sure Josh has information that maybe in this next meeting we can explore a little bit further. And as far as the incident rate goes, yes, it's gone up. But overall, over the last 2 weeks since our last meeting, things have stayed relatively flat. Even though there's been incremental income, the gross increase was prior in earlier December after Thanksgiving. So I'm just saying that I'm in huge favor of continuing this conversation. I think that we can bring other measures to the table. I know that we're maybe one of the fortunate ones that haven't seen incidences in our particular establishment. We do everything we can to follow the rules. We've been visited several times by Consumer Protection, and sure, we've had a time or two where it's been very difficult to get people out the door. I'm a very big advocate that I think the curfew is counterproductive to our goal of keeping people spread out. I know that some people view that as an easing, but I really see that as more of an unintended congestion problem. And if we're really trying to keep people spread out, then I am still in favor of looking at that as a further mitigation, is to actually lengthen the time of service for indoor dining. In some information that I'm reading in data collection, and I really don't want to get into just debating data, but I'll just bring it forth, is that in the 22 or 23% of unknown cases, where they're trying to identify where those unknown cases are coming from, restaurants rank way below skiing. And so, yes, our worker population is showing exposure, but if we're trying to define where the unknown is coming from, which is about 1 in a little less than 5 of all cases, that's why I'm saying if you're going to shut it down, all because the red restrictions for retail still allow 25% or 100% capacity in hotels, or the ski lifts being open. If you're going to do this, and this is your direction, my only comment then is at least try to be effective with it. And being effective with it means shutting the whole thing down. And I don't think anybody wants to do that. Those are my very brief 2 cents. I look forward to another meeting where we can be more interactive and be more creative about how we can possibly help the situation. We've always been here to help the situation. We are not looking to hurt the situation.
Thank you, Jimmy. Other hands?
Marky, do you want to look at the chat box, or I'm happy to keep with the public comment and letting people speak?
Let's continue with the public comment, and if all of you who have access to the chat box want to go through it as well, we'll come back and begin to sort through the questions coming forward or the recommendations coming forward on the chat box.
Okay,
So,
great.
Public.
Yeah, thank you, Marky. So I do have a number calling in. Last 4 is 3230. I'm going to allow you to speak if you want to chime in. Thank you. And since you're calling in, you might have to press *6 to unmute. Looks like you're unmuted, but I don't see you speaking. Here we go. Maybe. All right, it doesn't seem like your microphone is working. Feel free to try again in a bit. We will move on to Samantha.
Hi there. I want to just echo what Jimmy Yeager and Wendy Mitchell said with regards to restaurants, that it does feel like there's an all-out attack on restaurants. And if we're going to try and attack this, I do think we need to close down everything at the same time and really have an impact. I will say that we have had people visit the restaurants and check on how we are operating, making sure we're following all the proper protocols. But I do know on the last talk we had, there were talks about cracking down on other sectors where there is informal gatherings with caterers and DJs and what have you. I received 2 calls from caterers I know last week that were scrambling to see if I could loan them a bartender for an event because they were short on staff. I also know DJs are booked like crazy, and it doesn't seem like there's any, check on that industry, just on the restaurants. I know we had issues since the beginning with a couple of people falling ill, where we've taken into our own hands. We've closed our restaurant in Boulder due to students that were infected so that we could clean everything, have everybody tested and reopen. We did the same thing here in town at the Wild Fig. We closed on a Friday night for 5 days. We shuttered the whole building to make sure everybody could get tested and reopened. We just did the same thing at the Monarch for 3 days based on a part-time employee and one full-time employee, paid to have everybody tested with the 24-hour test because we didn't want to wait 5 days for the processing of the free tests in town. But nobody asked us to close. We did that of our own volition in order to try to do the right thing. And I think that restaurants, when they're presented with that situation, do make the right calls. I know that we do, and several of our other restaurateurs do the right thing. So I think closing down the restaurant sector isn't necessarily the only solution to this problem.
Thank you, Samantha. Does anyone have any questions for Samantha? Samantha, thank you very much for very focused on public health and sanitation in your restaurants. We've got 1 or 2 examples over here in Snowmass as well, who have closed for deep clean. So, and the notion of other industries, I don't know what's going on and how we can control the DJ issue or the private parties that are going on at catering. Jordana, has staff talked with those 2 little segments that are doing all the private parties?
We've done outreach to, and Brian, you can jump in here with exactly who we reached out to, but caterers, valets, anything we could think of that was related to the private party type of situation. So they know the rules. And again, we don't know about these private events unless someone reports them to us.
Yeah, exactly. It's really difficult for us to chase down these private chefs that are going to people's homes. And without us having any knowledge of these things happening, it's impossible for us to try to do anything about it.
Patty? Patty, you're muted.
I'm just waving at Jeanette. She's leaving the office.
Okay.
All right, we have 3 more individuals who would like to speak. Elizabeth, if you want to check in with us.
Yes, can you hear me okay? I hit unmute.
Yes, we can.
Great. I am a visitor planning to come to your community in about a week and a half. So I saw this, public meeting open and joined it because I wanted to better understand what's going on in your community and the risk. And so my top questions are, I saw I think it was Josh's presentation at the very beginning, one hotel had 21 cases and one had 4. And I'd like to know what those hotels are because I'd like to know if that's where I'm staying. In addition, because I want to minimize the risk to me and my family, obviously. And, which restaurants had the cases of like 17, 15, 11, 10, 5? Because similarly, if I knew there was a current outbreak of that proportion, I would not take my child and myself there. And then 2 other questions. In the information Josh shared, there was no breakdown about restaurants on the ski mountain. And I don't know if that's considered part of your county and included in your results. And if so, if you can share what those restaurants were, because we wouldn't go on those restaurants on mountain if there had been outbreaks. And also someone brought up grocery stores. Obviously, if we come to your community, and obviously we're coming to ski, we planned if there were, you know, not if there were a lot of outbreaks in restaurants, going to the grocery store and cooking in our hotel room. But I think it was Patty raised the concern about the grocery stores there. And so I don't know if you have, you know, when you say retail, are grocery stores included in that? And do you have any specific information that you can share with the public about the outbreaks in the grocery stores?
A lot of questions there. Is it possible that we have your information, Elizabeth, and our staff member get back with you relative?
Yeah, I registered my email when I logged onto the call, and I can follow up and call you after this call.
Okay, so are you staying in Snowmass or Aspen? That'll help us out.
Snowmass Village.
Snowmass Village, okay. I'll ask one of our staff members who's very well acquainted with Snowmass Village to give you a call back relative to what's happening in the village. And
Okay.
welcome to Snowmass.
I beg
Okay.
your pardon? Thank you.
Any other questions or comments?
Yes, Marky, we do have Michael Goldberg who wants to speak as well.
Okay, Michael, good afternoon.
Hi, Marky, and hi, everyone. So, first of all, if restaurants are 43%, and I'm not for a second trying to downplay this, the issue of restaurants specifically, but there's still 57% of the community in some fashion or another that also represents outbreaks. And I do think that, I'm sorry, I do think that the conversation about closing is best had with the restaurant community, with the business community as a whole, because I do think there can be resources, but I can give you some my personal experience here. We're doing testing today. We Matsuhisa are doing testing today. We're testing every employee, and we're doing that through the county in a program that they have dealing with outbreaks, and it makes it as painless as possible to gather everyone at one time. And this is a result of, as I said, of us having an outbreak, and we have a number of people quarantined and more than 2 who've tested positive. And we think we're as compliant as we can be. And to the extent that we're not, we sure want to know it, because you know, we believe that compliance by everybody is really important. So being compliant isn't a guarantee that you won't be affected. And I've talked to 4 other restaurant owners in town in the last 24 hours who have a very similar circumstance to ours. So again, I'm not downplaying the extent that I think the restaurants are a cause. I also think that there is some lack of understanding, I say that respectively, of just how rampant bad actors are. The idea of personal responsibility, the idea that we should be self-policing, we as restaurants or businesses in general, the number of private parties, the number of after-hours events that I've been hearing about in other sectors and in restaurants, of hotel parties, parties in hotel rooms over the last 3 weeks, is frightening, frankly. And I understand that we're dealing with community resources, but those resources, if they're spread out, are in need of more resources, because there's just so much more out there that's happening that you all aren't catching. And that, and I understand the restaurant industry's perspective of saying, you know, woe is me, or we're being singled out. And I do think that we can come up with other ideas. But I think the whole community's got to participate. And I'm going to use the nasty word that I keep using every time I speak, and that's curfew. I know it worked in Denver, and our restaurant there was closed on November 20th, and we opened for service the first part of this week. But my fear is that if you close the restaurants down, and this has to, I want to talk specifically about the dial and using red as a measure. I think we have to go beyond red, and I'm not suggesting that we move to purple. I'm suggesting that we move away from the definitions similar to what we did when we did Orange Plus and came up with some things that we thought around Thanksgiving would be meaningful. Maybe they have and maybe they haven't, but I'm still fearful of getting tied to a number and a concept where we get in and we can't get out. And I look at it from the restaurant's perspective of saying, well, if we're 43% of the community spread or outbreaks, I'm sorry, and there's no meaningful change in the other 57%, and the restaurants shut down, and the other 57% is still going on, does that mean that incidence levels are going to reduce at a much slower rate and therefore will be stuck in red as restaurants and be closed down in a much longer period of time? So, I mean, that was a fear we had that brought us to Orange Plus to begin with, the fear of getting into red and then not being able to get back out of red. And I'll raise the same number that I've raised before, and that's 1,200 people who would be shut down or who would be on unemployment if all the restaurants were shut down. And I'm not suggesting that for a second that I don't think a meaningful shutdown and a defined shutdown and an overall shutdown wouldn't be impactful. I think it would be more impactful if it extended well beyond the restaurant community. And you know, again, looking from a personal perspective, I can see us having the same thing Samantha said. At some point you run out of people, and at some point you think about, well, whether or not this isn't the right thing to do to begin with, just to cut the spread down. But again, if it's not involving other people, it's too much of an impact just on us. As far as outreach, I want to commend the county for coming out with the guidance for employers this week. It was very, very helpful information, particularly when we're in the midst of trying to determine what it is that we're supposed to be doing. But that, again, is something that I think I'm going to keep harping on, and that is resources, and the resources to be able to go out and make sure that everybody is supposed to be doing what they're doing. As for closing, if we were to close, and I do think we ought to really dissect this over the next week. But if we were, I think the sooner you do it, the better. In some respects, we should have looked backwards. I mean, if I could look backwards, I would have closed over Thanksgiving and used that 3 weeks to clean everything up, if that's what could have been done. But I now think, you know, I'm still of the same mind. I want to stay open. I want to stay out of red, and I want to keep the ski season open. And the further we march down the road, the more difficult it is as we get toward March to really save our season. So I appreciate the opportunity, and sorry for being verbose.
Thank you, Mike. Very, very tough conversations and impacts are being brought up. Any other person that wants to make a public comment?
Hey, Marky, we just had one last individual. David, please.
Hi guys, can you all hear me?
Yep.
Hi, my name is David Andrade. I am one of the contact tracers here in Pickens County Public Health. Just wanted to give a brief comment, a couple comments actually. First thing, we've been kowtowing to the restaurant industry in this county for far too long. We've been on a lull since summer as far as letting indoor dining happen, especially now that winter is upon us. It's here and it's cold. You know, this virus has a fun time indoors. That's where the spread happens. It doesn't happen outdoors for the most part, especially in my experience. And as far as my experience with speaking with individuals here in the county and out of county as well, since a vast majority of employees that work here in this county in the restaurant and hospitality industry as well as SKICO, live in Eagle and Garfield, that they come here to work. My experience, I have noticed quite a bit of employers, local employers, restaurants, hotels, not paying the legally required FCRA, sick leave, to folks that are quarantined and under isolation. And that is the Colorado Healthy Families and Workplaces Act that was passed back in July, where it requires up to 80 hours of sick leave to all employees that are under isolation or quarantine order from a public health authority. And in my view, I've seen employees in this county bear the brunt of so much of what's going on, especially with the amount of tourists and out-of-state travelers that come in here to our county, and not just, they just help spread so much. Not to mention, SKICO is one of the few ski resorts in the state that do not have reservations systems like Vail Resorts does. And that is inviting so many folks to come out here and recreate, just like what we had that call earlier from one of the public comments of one of the folks that were there that wanted to travel here. And that's something that I think the county should work on a lot more, is preventing more folks to come here during a pandemic. I mean, these are folks that can afford to come here. You know, majority of Americans are living day to day with this pandemic. And if I understand the business owners are looking at their bottom line, but in my view, considering the amount of workload I have on a daily basis, speaking with 10s, 20, 30, 40 cases a day, and our team is just stretched to the limits when it comes to this. And not to mention, the restaurant seems like they're talking about, oh, we need to be more creative, have more ideas. I mean, I think we've been stretched thin on that now. I mean, we did Orange Plus. Like, that's not even, you know, as far as we've already tried as far as solutions. And right now, in my view, as somebody on the ground dealing with COVID on a daily basis, speaking with parents, speaking with children, teenagers, with adults, seniors, folks that are on oxygen, it's just getting to the point where we had 400 cases in November. Now we're at 1,300. That's a crazy jump, an exponential jump. And I just wanted to give sort of that comment to let you guys know on the ground that this is just, it's just getting to the point where we cannot do the jobs that we were hired to do, to protect this community and to make sure that you know, everyone is healthy and safe. And I just wanted to give that comment so at least everyone has a bit of a context when it comes to what we're doing in the public health level, as far as us as contact tracers and case investigators. Thanks, guys.
Thank you, David. Krista?
Thanks, Marky. I just wanted to make a comment, and this is one I read from the chat box too, but we've heard a lot about restaurants. We've heard about SKICO. I just want to bring the kids back up, because I feel like, you know, the workers that do work in our restaurants and work in our community all have kids. And the kids are the unseen people at this call in this conversation. This spread amongst adults, however it's being done, is drastically affecting our community and our children. Their school, their recreation, their after school activities, their mental health. And whatever you know, again, I think we're kind of getting lost in the weeds of, do we go to red, do we go to purple? When they shut schools down back in March, part of the reason they shut schools down was to get parents to stay home, because people at home do not spread this virus. Whatever this town needs to do, we have got to stop interacting with each other. I don't know if that just means restaurants or if that's purple or whatever, but there are drastic measures that need to be taken, and our kids need to be thought of in this conversation.
Thank you, Krista. Kim?
Hi, thank you. And I just want to thank everyone for all their comments. This is such a complex situation, and I want to echo everything that the restaurateurs said. I feel that if we look at these definitions of red and orange, they were all created by the state, and they had to create different metrics, right? I want to remind everybody of the data that was presented at the last meeting of all of the counties that were in red and how effective that was. And then they reached a place where then they were able to get back to orange. So we know that red works from this data. We also know that it's clearly unfair that restaurants are being targeted. I mean, we all know that there are so many different avenues of spread here, and all of the arguments that have been brought up today in terms of spread coming from private chefs and private gatherings and all these places, which are harder to enforce than saying restaurants need to shut down, which is an easier thing to enforce. There's so much complexity here. My viewpoint at this point, hearing everybody, is that we look at the red data, we go to red knowing that that does target restaurants, but let's be creative and think about other ways. Let's do a red plus for 2 weeks. Let's think as a community, what are the other ways that we can cut down on this that doesn't just target restaurants? Because they're clearly a source, but not the only source. And there's so many other factors going on here. It is just an imposed list of things that the state created just to create these metrics. So if we think outside the box, I would just propose something like that, really thinking about the data that was presented at the last meeting.
Thank you, Kim. Anything else in the chat box?
Marky, we've gone ahead and closed the public comment.
Okay, thank you very much. Brent?
Yeah, this came out of the chat box. I don't think it was touched on, and it really belongs to Ski-Coast province, but since they're pretty important, this was observed by a number of people in that the lifties really aren't asking people to put on masks, and they only do it when they do as you pass them, when in fact it ought to be done at the beginning of the line, at the far point of the line. So because these people are going to be interacting with each other and conversing pretty close distances all the way into the lift. So anyway, this came out of the chat box. So there was that suggestion to kind of reinforce that kind of behavior with the Ski-Co employees, maybe recruit some people, mask minders that just, observe and kind of like the ambassadors. And that's another good place to start. We've got ambassadors already, make them sort of mask conscious of it. And that's primarily it. I won't read the whole thing, but I thought it was a very good idea, and Ski-Co could certainly very easily and really no expense, kind of help that kind of compliance.
Thank you, Brent. Any other comments from the board? Okay, so under consideration, Jordana, you want to put up the recommendation from staff, and we will be reconvening 1 week from today at the same time at 1 to really open it up for public comment and feedback as each segment of the industry looks at what's happening. So Jordana?
Okay, so there is the staff recommendation. And Marky, is the intent to use the Board of Health meeting on Thursday as the public meeting, or do we want to have a meeting earlier in the week where we're able to get all of the public comment and ideas from the community about it's sounding like there's agreement that we need to do something, that we need to gather those ideas and then bring them for final decision to that Thursday meeting with the Board of Health?
There's several steps I was thinking of. Sooner the better would be great. I would anticipate that the BOCC may need to meet regarding the recommendations. Town of Snowmass Village, Town Council might want to vet within our community as well as the city of Aspen. So that's the reason why I was going to suggest a week so they could also engage the community and industry in their work. But I'm very open to holding another meeting as early as Monday or Tuesday, unless I hear otherwise from the elected officials. Any comments? Tori? Which way?
thumbs up. If there's a coordinated effort that wants to be made for Monday or Tuesday, public outreach, public information and input sessions, that sounds great. But it really sounds like this is going to come back to this board next Thursday. So,
Well, we're talking now about moving it up to maybe even Tuesday.
my board has an evening meeting, so 4 o'clock,
Okay.
5 o'clock Tuesday.
Yeah, and our board has meeting and swearing in ceremonies and such. Mark, I understand the urgency, but I think it may take some time to process the amount of public input I think we are likely to receive to be digested by the board. I would suggest the Thursday meeting to give us time to get scheduled, digest, because I don't think this is a simple yes, no on this recommendation. What I've heard in the conversation is that there may be a whole nother strategy outside of the state framework in terms of a short-term shutdown or such. But I think we've got meetings Tuesday and Wednesday with our board. And I think to expect us to pull off a public meeting tomorrow and process it is probably too short of a timeline.
I think it's very short. And personally, I really got to digest all of this. I mean, there is a lot of consequences, unintended and intended consequences of every decision that this board will be making. So I would suggest next Thursday at 1 o'clock. Does that work? Tom has his hand up, yes. Tori had his thumb up. Okay. Therefore.
Marky, quick question.
Yeah.
Greg here, thumbs up on that. I do think we need more time, as John suggested. I was going to try to get through to him to ask him if he thought we could pull this off sooner, but I think Thursday makes sense. So I'm good with that for our board. I did want to bring up that I think we need to bring ski company and the other 800-pound gorillas into this conversation and the feedback session, because how activities are happening on the ski areas and with the bus connections to the ski areas through RAFTA and ski companies, bus operations all need to be looked at and reviewed after this holiday season. We've had comments regarding, lift lines and lines for buses and all this. There could be other things that we haven't really examined. And so I just want to make sure they're part of this conversation, especially as we're looking at an X Games coming with 500 people. I think we need to have that conversation as part of this one as well, or at least in parallel to it very soon.
Okay, well, thank you very much for that comment. I guess the question, 2 weeks ago, we committed that if our incidence rate did not come down, we would go right into full red. And I hope the board remembers that. I guess it was 3 weeks ago. Now the question is, we're at 2,200 incident rate today. How much higher does it have to go? Do we think we can get some improvement over the next week or so? But we're not getting to where we need to be for a safe environment for our kiddies to get back to school. I mean, they're back in school and now we've got classrooms shut down, buses shut down. And hope to goodness we don't see the hospital getting impacted. All of these are strong concerns. I am concerned about the number of healthcare workers that are out. It's really impacting the community. So next Thursday, we'll come back together at 1 o'clock. And decisions will need to be made after we hear from the various segments of the business, the BOCC, City of Aspen, City and Town of Snowmass Village, and their process for getting input. Does that seem reasonable to get done, Brent?
Yeah, I just wanted to say, and I completely agree with you that you can't run a battleship by a democracy, and I think we're guilty of mission creep. which is quite typical, right? But we're redefining where the goalposts are. We make a decision and then we're also, it's a complex environment. And so there's maybe too much information. But I do think we need to really focus on, like Jesse said, the public, the children, the schools, the reality out there, and there's going to be damage no matter what. If we do nothing, there's damage. It's going on all over, and we simply need to mitigate it as best we can. Thanks.
I think a week is too long. Can we, I mean, I understand getting public comment, but this is a pandemic where we're having an emergency. Can we just have a public meeting tomorrow and just make it happen since it's such extraordinary circumstances right now?
Well, I'll see what other board members think there. I know John really wanted to talk to the BOCC, and Tori wants to talk to his council, and Billy Madsen wants to talk to his council. I think to give them time to do so is in the best interest. And we do know the restaurant industry wants to probably sit down and talk, and SCICO is going to want to sit down and talk. If we're going to have RAFT on the call next week, they need to be notified. I mean, this is a huge issue.
Can they do it over the weekend though? I mean, since it's such, I mean, I just feel time is of the essence.
Well, I think you're asking a lot there, Krista. Yeah.
Have to ask.
Sure, it's better to ask than to ask for forgiveness. Thank you very much, Krista. Okay, yes, Jeannie.
Is there anything we can do right now to stop the spread? I mean, maybe we can have fines for people who have parties. We really need enforcement here. We have not had proper enforcement in our town, and that's why there have been parties and DJs and catering. And we really need to buckle down and do something. Next week, we could have 1 in 20 people being infectious.
That's exactly right. So I wish I knew how to get to all the catering companies. That's staff can figure that out.
Well, they know, we have communicated this with them. So I would just say if anyone knows of these events, like we need to you need to let us know and we can enforce on that. It's still not going to change behavior. That alone is not going to change our incidence rate. You know, I understand wanting to get everyone's feedback in public process. And the higher our incidence rate goes, the longer it's going to take to turn it around, and the more people who are going to be affected by COVID, the less able our team is going to be to reach out to everyone who becomes positive to do any kind of boxed in and contact tracing. So I just think leaving here and leaving that much time before we meet again, our incidence rate is going to continue to increase.
Greg, you guys are shaking your head. What's your thoughts here?
Well, I'm listening to Jordan and I agree with her. Josh just posted on our chat that a week means 200 more cases. He's anticipating another 200 cases that will have to be dealt with in the community if we put it off for a week. So that shows the cost of delaying. I understand that it's going to be hard to get information back from all our various boards, but I would push for a special meeting. Maybe we should say Monday, and that means people work through the weekend if necessary. And I would advocate for that. And I'm sure John's going to shake his head at me, but seriously, maybe it's just a public input meeting. But do you think that would help, Tori? Bill, or is that something your boards could work toward? Maybe just a public information meeting on Monday after we've had the weekend to work on this. Does that help us?
For me, Greg, I really need to talk with council members. It's not so much about public input. It's more about council members as well as my city manager to understand, how we move forward with new restrictions. It is just not as simple as saying, hey, no more indoor dining. We have other considerations. I'm all for, if you want to get this board together again on Monday, that I can do. I have the support of my board for the recommendation as it came forward with questions. So we were prepared to be discussing this a week from now. If we want to move that up, I'm sure I can have my conversations with my board members by Monday. But I could use those days.
Okay,
Yeah, and I would second that. The sooner we can meet again, the better. And this is serious enough. As Tori said, all of our council members will be willing to discuss this over the weekend.
We moved the meeting from Thursday to Monday.
okay. How does Monday work on everybody's calendars? From 1 to 4? Jordana?
Yeah, I think I just want clarity, you know, on what's being discussed, because I think there was a lot that was covered. So there's the staff recommendation, which is really just moving to the red level that exists. And then the other conversation that I heard come up was, do we need to do more? Do we need to do more than just that across the board? And I don't think we all have the same understanding of what that more or purple shutdown or take a pause for 2 weeks. I heard it called a lot of different things. So I'm wondering how we get clarity on that while everyone's going and discussing in their different ways to be able to come back and make a decision together if we don't have that clarity.
So in terms of what my thought would be is for sure the staff recommendation. We really do need to discuss. We need to look across the entire industry map, not just the restaurants. We could be doing more, perhaps even with hotels. We do see some spread there. What are we doing with grocery stores, as Patty so articulately suggested? So perhaps it will be, we do an industry sector by industry sector to include ski-go, to include bus transportation, public transportation, and then loop back around to the staff recommendations and modifications thereof. Yeah, Brent?
I just, you know, of course, I appreciate all of this, but we're trying to dice this up 100 ways. And as, you know, Dr. Levin said, you know, all these metrics are human constructs. They're just an attempt at people to rationalize the data and come to some sort of conclusion. But to some degree, right, it's arbitrary. The fact is, these are serious times. And as Michael Goldberg said, he kind of wished we'd done this complete shutdown in Thanksgiving. So, right, we could argue that's how far behind we are in this thing. The big danger is if when you're fighting a pandemic, we even know the lead times, 3 days, 7 days, you know, 3 weeks. The point is we're behind, we're always acting retrospectively, and we have to do the exact opposite. And here we are again with somebody who's, you know, quite knowledgeable, Michael Goldberg, basically saying we should have done this in November. And I completely agree with him. So we can't just keep postponing this decision just because it's painful. So.
Well, there's another thought that I had. One would be the staff recommendation. 2 would be, quite frankly, to go to a full shutdown for 2 weeks. I mean, that doesn't sound like any fun.
Well, I think it's a terrible thing, but people somewhere, if not dying, are being disabled. This is, you know, this disease is incredibly complicated, and there's long-term effects to people that even think that they haven't suffered any. I've heard of people 2 months out with no symptoms. All of a sudden, a few symptoms present themselves, and they stay with them, you know, for months on end, if not permanently. So I think we're dealing with something that's super serious with lives at stake, and I think we need to do what we need to do, and which is act swiftly, clearly, with good messaging and strong enforcement, period. Whatever that means, it needs to be strong and it needs to be understood. These are very serious times. And And I don't think we certainly haven't had the enforcement angle on that very much at all. And we've seen some pretty weak compliances, and then we've had some pretty bad messaging overall, I think, or weak. And this is true for a lot of communities. So it's not just for us, but it's a problem everybody faces. And I think we can only kick the ball down the road so far until we run out of ball or run out of road.
I would say too that I think it's our job as our county to get our incidence rate under control. And if that means a full shutdown, I think that's what it does, because we also are attracting people to come here and stay for a week, go to our restaurants for a week, ski for a week, and then they go home and they may not even get sick here. But if you looked at one biotech conference in Boston from last February, 250,000 people got infected from that one experience. So our incidence rate can be having effects across this entire country. And I think that's important to know too.
Thank you, Chris. The other thing I saw come across, I think it was from Kurt, and that is purple, the purple level restrictions. Jordana, is there any way you could push those out to all the board members so everyone is on the same page of what purple does look like? That'd be very helpful. And let me see if I got other messages coming in. No? Okay.
Marky, I can share after this meeting, I can share purple, and then we can maybe go back and look at our first shutdown back in March, and have some drafts for what a more comprehensive across the board would look like.
That would be wonderful, Jordana. Is everyone in agreement with Jordana's suggestion there? So you'll watch your email for purple level. And then we'll be looking at what the March strategy was. I mean, that seems like so many moons ago, but it really was not that long ago. And hopefully we could get this thing whipped. So we've had some very good news today from the hospital with the number of vaccines that are coming in. So let's find some joy in the fact that more and more people are going to get vaccinated. But at the same time, we're going to have some very, very tough conversations on Monday, starting at 1 o'clock. Anything else? If not, I'm going to move.
Marky, Greg here. Just want to make sure everyone does see the chat. Kim Levin asked about, could we possibly vote today on this, on the going to red? And I was going to say we could actually propose to do that with the idea that we may change again on Monday, depending on what we conclude. But I do get the sense of urgency that we need to keep moving on this. And then there is the conversation that Kurt mentioned about, should we be talking about purple? And I think he's right on, and we should be having those conversations, sooner the better. I did want to make sure that everybody's included, but I think if we're going to talk seriously about closing things down more and becoming more restrictive, my first question of the day was, what's the optimal time to do that? Do we need to give people several days notice so they can work through their perishables inventory, for instance? If we're going to do this, it'd be nice to have some coordination with restaurants, hotels, et cetera, and public health, so we can be prepared for this shutdown, whatever form it takes, if we come to that. Because I think that's what we're talking about. I want to make sure if we don't, I worry that we're rushing into it. On the other hand, time is of the essence. So
yes,
trying to articulate that. Thanks.
Thank you, Greg. Yes, Anne.
Yeah, after seeing all the data today and the conversation that's been going on in the chat room, I personally would support supporting staff's recommendation or something even more strict. I don't know what the other my other council members are saying. On the other hand, Tori and I are appointed to this board because they trust that we will make the right decision. One of the things that has come out that's so important is to do something sooner than later, and not just keep pushing this down another 4 days, another week, whatever. I'm not the voting member at this time, but I certainly feel very strongly that we need to get the hammer down on this thing. It's only getting worse.
So
Right.
if we could plan to move on Monday to make it, we're going to be voting on this on Monday?
We're going to vote on it on Monday, and we'll have the purple restrictions out as well. And then Jordana was very smart to suggest, let's look at what we did last March when we went to shutdown. So.
And there will be no meeting on Thursday.
No meeting on Thursday, Monday at 1 o'clock.
Right.
Okay.
Good.
Do I have a motion for adjournment?
Motion to adjourn.
Thank you. All in support?
All right.
Take care all. Have a good weekend and behave. Stay healthy. Stay well.